The two scars ran from just below her left ear to the base of her collarbone, thick, raised, the color of old rope. And they were the first thing anyone saw when Nurse Mara Voss walked through the glass doors of Harwick General Hospital in Delport, Washington. Not her credentials, not the quiet steadiness in her hands, not the way her eyes moved through a room like someone who had already calculated every exit, just the scars. A patient's mother grabbed her child and stepped back. An orderly turned to whisper something to the woman beside him. And from across the nurse's station, charge nurse Diane Pratt looked at Mara the way people look at something broken that someone forgot to throw away. Before this story goes any further, if you've ever been underestimated, written off, or pushed out of a place you belonged, this one's for you. Hit subscribe right now, because what happens to Mara Voss inside Harwick General is the kind of story that doesn't let go. Like the video, drop a comment telling me what city and country you're watching from. I want to see exactly how far this story travels. And don't look away. Because what looks like a wounded woman walking into a hospital is actually something else entirely. The intake paperwork took 11 minutes. Mara knew because she counted, not out of anxiety, but out of habit. Counting was something you did when silence made other people uncomfortable, and you had learned over a long number of years that filling silence with words only gave people more material to use against you. She sat in the plastic chair outside the HR office on the third floor of Harwick General Hospital, her navy duffel bag between her feet, her hands loose in her lap, and she waited while the administrative assistant named Trish shuffled paper with the studied slowness of someone performing busyness rather than doing it. Delport was a mid-sized city on the Washington coast, the kind of place that called itself a community while its hospital system quietly hemorrhaged staff every 8 months due to what the administration referred to in press releases as restructuring and what the nurses called, with less diplomatic precision, a meat grinder. Harwick General had 340 beds, a Level 2 trauma designation, a newly renovated lobby that smelled like carpet glue, and a reputation among traveling nurses as a place you took when nothing else was available. Mara had taken it. Her assignment was a 13-week contract through a staffing agency out of Portland, trauma and ICU rotation. The pay was adequate. The hours would be brutal. She had read the staff reviews online before signing, 2 stars on 3 different platforms, recurring complaints about the charge nursing staff, a specific and repeated mention of a trauma surgeon named Dr. Callum Reese, who was described variously as a nightmare, the reason I quit nursing, and most succinctly, a clinical sociopath with good board scores. Mara had read all of it and signed the contract anyway. She was not here because she had no other options. She was here because Delport was quiet. The apartment she'd rented was a 12-minute walk from the water, and she had not lived near water in 4 years. That was the entire calculation. Trish slid a laminated badge across the counter without making eye contact. Orientation's already started. 3rd floor, conference room B. Try not to be disruptive. Mara picked up the badge, looked at the photo. Taken 2 minutes ago, flat expression, the scars clearly visible above the collar of her scrubs, and clipped it to her chest pocket. "Thank you," she said. Trish had already turned back to her screen. Conference room B held 7 other nurses, a respiratory therapist, and a hospital educator named Gary, who was working through a slide deck with the enthusiasm of someone defusing a bomb he'd already defused 300 times. Mara took a seat near the back. The woman to her left, a compact brunette with a travel mug, and the specific posture of someone who had been a nurse for at least a decade, glanced at her, glanced at the scars, and then deliberately looked back at the presentation. Not with disgust, just with the careful neutrality of someone who knew better than to stare. That was the first thing Mara noticed about her. The second thing was that her badge read R. Calloway, RN, ICU, trauma, same rotation. Gary was explaining the hospital's new patient satisfaction initiative, which involved comment cards and a digital kiosk in the lobby. Mara wrote nothing down. She had not taken notes during orientation since 2011. What she was actually doing was mapping the room, windows, exits, the squeak of a loose ceiling tile 2 rows above the door, the fact that the man in the 3rd row kept checking his phone with the angled caution of someone who thought he was being subtle, the way Gary's left hand trembled slightly when he clicked to a new slide, stress tremor, probably caffeine-related, probably nothing. She was doing it without thinking about it. She had stopped being able to turn it off somewhere around her 3rd deployment, and at some point she had stopped trying. After orientation, she found her locker in the staff room adjoining the trauma wing. Someone had taped a printed sign to the locker next to hers. Property of D. Pratt. Do not use. The locker itself was clearly a standard staff locker. Mara opened hers, hung her bag on the hook inside, and began changing into her hospital-issue backup scrubs when she heard the door open behind her. "You're the travel nurse." She turned. Diane Pratt was in her mid-40s, tall, with the kind of posture that came from years of being the most important person in any given room. Her scrubs were pressed. Her hair was pulled back with aggressive precision. She stood in the doorway with her arms crossed and her eyes moving over Mara the way a building inspector looks at a structure she already suspects is not up to code. "Mara Voss," Mara said. "Yes. I run this floor." Pratt's voice had the flat authority of someone who said this to every new staff member and meant it as a warning rather than information. "I don't care what agency sent you or what your last facility let you get away with. Here, you follow protocol. You don't improvise, you don't freelance, and you do not go above your scope of practice. Are we clear?" "We're clear." "The scars." Pratt said it the way you might say the smell, as if she were naming something that had already been decided to be a problem. "Patients are going to ask. I need to know you're not going to make them uncomfortable." Mara looked at her for a moment, just looked. "I'll manage," she said. Pratt's eyes narrowed slightly. She had expected either more pushback or more deference, and Mara had given her neither. She left without another word. The woman from orientation, R. Calloway, was at the sink when Pratt walked out. She had come in quietly enough that Mara hadn't registered her, which was unusual. She was rinsing her travel mug with the focused attention of someone who had heard the entire exchange and was choosing her words carefully. "She does that with everyone," Calloway said, without turning around. "Especially travelers. It's worse if she thinks you're actually competent, because then she's afraid of you." "I'm not here to be afraid of," Mara said. Calloway turned, looked at her directly with dark eyes that were assessing without being unkind. "No, I don't think you are." She stuck out her hand. "Rosa, ICU 2 years, trauma 18 months. I know where everything is, and I know which attendings will actually listen to you and which ones will pretend to, and then do whatever they were going to do anyway." Mara shook her hand. "That's a more useful orientation than the one Gary ran." Rosa almost smiled. "Gary hasn't been on the floor in 6 years. He just does the slides." She dried her hands, slung her stethoscope back around her neck. "First shift's in 20. Dr. Reese is attending today, so whatever you're expecting, adjust it down." The trauma bay at Harwick General had 6 bays separated by curtains, an equipment alcove on the north wall, and overhead lighting that hummed at a frequency that gave Rosa what she described as a very specific kind of headache, and that Mara didn't notice because she had spent enough time in places lit by generator power and flashlights that fluorescent tubes were a luxury, regardless of how they sounded. The morning census was standard for a midweek open. 2 MVA follow-ups, 1 septic patient transferred from a rural clinic, 1 elderly man with an apparent cardiac event who had been stabilized but not yet moved upstairs. Mara moved through her first 3 hours with the economy of someone who had been doing this in various capacities for 15 years. She knew where things were not because anyone had shown her, but because the layout of trauma bays followed a functional logic she had internalized so long ago. It lived in her hands rather than her head. She repositioned an IV line that had been taped poorly, caught a medication error on a chart before it reached the dispensing stage. She said nothing, just quietly flagged it to the pharmacy herself, and talked a 23-year-old with a fractured wrist through his pain assessment without once speaking to him like he was less intelligent than he was. She was checking a pressure cuff reading when she heard it for the first time. A male voice behind her, not directed at her but pitched at exactly the volume that intended to be heard. "Travel nurse." "No, the one with the..." "Yeah. Looks like she was in some kind of accident. Honestly, I don't know why the agency sends us these people. Patients shouldn't have to see that." She did not turn around. She finished reading the display, 118/74, improved, wrote it on the chart, and moved to her next patient. Dr. Callum Reese was not what she had expected, which was a piece of information she filed away and said nothing about. He was younger than his reputation suggested, early 40s probably, lean in the way of someone who ran competitively, with a kind of coiled energy that looked like confidence from a distance and looked like something less stable up close. He made rounds at a pace that seemed designed to prevent anyone from asking him questions, moved through charts with the speed of someone who had already decided what he thought before he looked, and spoke to nursing staff with the brisk dismissiveness of someone who considered direct communication a concession. He stopped at the foot of Bay 3, where Mara was adjusting a drip rate. He looked at the chart, looked at the drip rate, then looked at her badge. He did not look at her face. "You changed this," he said. It was not a question. The rate was set for the previous weight on intake. Patient's post-op weight came through an hour ago, adjusted accordingly. A pause. "That's a physician order. The original order specified rate by weight. The weight changed. I documented everything." He looked at her then, directly, for the first time, and there was a flicker of something in his expression she could not quite categorize. Not respect. More like the recalibration you do when an object turns out to be heavier than it looks. "Don't freelance," he said, and moved to the next bay. Rosa appeared at Mara's shoulder 2 minutes later, pretending to check a supply cart. "Congratulations," she said quietly. "That's the closest thing to 'you might be competent' you'll ever get out of him on the first day." "I wasn't looking for it," Mara said. "I know. That's probably why you got it." By midday, the whispers had organized themselves into something more coherent. She caught fragments in the break room, in the hallway outside the supply closet, at the nurses' station where 2 of the staff nurses had apparently decided that voices lowered to 2/3 volume constituted privacy. "Doesn't she know how that looks?" patients are asking. Mrs. Holbrook in Bay 4 said, "It made her nervous, just having someone like that. You know, it's not about discrimination, it's about patient comfort. There's a real argument that..." She ate her lunch in the staff room alone. Not because she had to, but because she needed 11 minutes of quiet and the staff room at this hour was empty. She ate what she'd packed, rice, leftover chicken, sliced cucumber, and looked at the wall and thought, not for the first time, about what it would mean to simply say the things she knew about herself and let it fill the room until all the small whispers burned off like fog in direct heat. She thought about it, and she ate her lunch, and she went back to work. The afternoon brought volume. A school bus had sideswiped a concrete median on Route 9, and Harwick General's trauma bay absorbed the overflow from the scene. 7 patients in under an hour, ranging from minor lacerations to a 13-year-old with a suspected splenic injury who came in pale and tachycardic and needed everything at once. The bay erupted into the particular controlled chaos of a mass casualty intake. Voices sharp and layered, equipment moving, someone calling for a portable ultrasound, someone else arguing about order priority in the door. Mara worked. She did not think about anything except what was in front of her. She moved between patients with a fluency that was partly training and partly something older, the kind of muscle memory that lives below conscious thought. And she was setting a second IV access on the 13-year-old, whose name was Jonah, who kept asking for his mother in a small voice between every other breath, when she heard the commotion from Bay 2 escalate past the threshold of controlled. The attending on the secondary case was a Dr. Fenn, a hospitalist cross-covering trauma, because Reese had been pulled for a consult upstairs. Fenn was competent within a narrow range. What was happening in Bay 2 had left that range approximately 4 minutes ago. The patient was a 47-year-old male, blunt thoracic trauma, deteriorating. He had come in with a BP that was already soft, and it had continued dropping despite fluid resuscitation. Fenn was attempting to place a central line, had been attempting it, from what Mara could hear, for longer than was reasonable, and the ultrasound tech was reading off numbers that did not trend in any direction worth trending in. Rosa appeared at Mara's elbow. "Jonah's mom just got here. I can take him." Her voice was low and careful, the way voices get when 2 people in a room are thinking the same thing and only one of them is supposed to say it. Mara passed her the chart, stripped her gloves, and moved to Bay 2. What she saw: Fenn at the patient's right subclavian, sweating, the field not where it needed to be. The patient's color was the specific gray that means the conversation with the body is almost over. His pressure on the monitor read 74/40. His eyes were open and not tracking. There was a respiratory therapist holding a bag mask, a tech standing with an IV kit that wasn't going to be enough, and a second nurse who was looking between the patient and the attending with the expression of someone waiting to be told what to do and becoming increasingly certain that instruction was not coming. "Dr. Fenn." Her voice came out level. He didn't look up. "I've got it." "His pressure's at 74. How long has he been at this rate?" I said, "I've got it." She looked at the monitor. She looked at the patient. She looked at the clock on the wall. Calculations she had run in other places, with other stakes, ran themselves without her permission. She moved to the supply alcove and pulled an IO kit, intraosseous, a drill-driven device for establishing vascular access directly into bone marrow when the veins have nothing left to give. It was not a complicated intervention. It was not a controversial one. It was, in certain specific circumstances, the fastest available path to keeping a patient on the right side of a resuscitation, and this was one of those circumstances. She came back to the bay. "I'm placing an IO," she said, not asking. Fenn looked up then. His face had the particular expression of a man who has just realized he is in over his head and has decided, as a defensive strategy, to be angry. "Excuse me, you're a proximal tibia." She was already positioning, already swabbing. "He's lost central access as a primary route and we are 4 minutes from losing him. If you want to take over now." A 3-second silence, the monitor alarmed. Fenn did not take over. She drilled. The IO seated on the first pass. She had done this enough times that her hands did not shake, had never shaken at this moment, which had always seemed to her less like a gift and more like something she had paid for. And she called fluids, called push-dose epi, talked to the respiratory therapist over her shoulder in the clipped shorthand of a resuscitation moving at the pace of a resuscitation. And the patient's pressure began, slowly and then less slowly, to climb. The bay was quiet in the specific way of people who have stopped breathing in order to watch something happen. Fenn stood 3 feet away with his gloves still on and said nothing. When the patient had stabilized enough that the immediate arithmetic had changed, 96/58, color returning, eyes beginning to track, Mara stepped back from the bedside and wrote on the chart and said nothing to anyone. She heard the monitor alarm fall silent. She heard someone exhale. She pulled her gloves and moved toward the door. "Who authorized that?" She stopped. Diane Pratt was standing in the doorway to the bay, arms crossed, voice carrying the hard edges of someone who has been watching from outside the room and waiting for the moment to enter. Behind her, at a slight distance that was its own statement, stood Dr. Reese, who had apparently returned from his consult in time to catch the end of something he had not been part of. "The patient was coding," Mara said. "That is not an answer to my question." The attending was unable to obtain vascular access. The patient had no central line and no viable peripheral access. IO placement was indicated. I placed it. "You are a travel nurse on your first shift," Pratt said, and her voice had the quality of something she had been wanting to say since 11 o'clock that morning. "You do not have independent authority to—" "The patient is alive," Mara said. The word alive sat in the room like an object with weight. Pratt was not finished. "This is an insubordination issue. I'll be filing a formal incident report, and I am recommending to hospital administration that your contract—" "Diane." Reese's voice came from just behind Pratt's left shoulder. It was not loud. It was the voice of a man who had learned that volume was rarely the most efficient instrument. "We'll handle this through proper channels." He looked at Mara. Directly. The way he had looked at her that morning in Bay 3, but this time whatever was in his expression was harder to categorize. "You're on administrative review effective end of shift. Don't go home. Wait in the staff room." She nodded. She went back to work. Rosa found her at the nurse's station 40 minutes later. "You know what you did?" Rosa said. "I know what I did." "They're going to make it about policy." "They usually do." "Mara." Rosa's voice dropped. "Fenn is already saying you pushed him out of the way, that it was reckless, that you didn't communicate." Mara finished her charting note, reviewed it, clicked save. "The patient's name is Gerald Marsh, 47 years old. He came in with a BP of 78 systolic, and I left him at 96/58 with color restored and GCS improving." She looked at Rosa. "That's the only thing I did." "That's not the story they're going to tell." "I know." She stood, picked up her stethoscope. "They rarely do." By 4 o'clock, 3 different nursing staff members had found reasons to walk past the bay where she was working and find other reasons to be there longer than necessary. Not out of solidarity, She didn't read it that way. More out of the particular curiosity that attaches itself to someone who has done something that changed the temperature in a room. The patient in Bay 2 had been moved to ICU. His family had arrived. Someone from patient relations had come down to the desk, which was routine following a high acuity case, and Mara had given her report in the same quiet voice she used for everything, and then gone back to her remaining patients. At 4:47, Dr. Reese appeared in the trauma bay doorway again. He was not wearing his white coat. He had the specific posture of someone carrying a piece of news they have not yet decided how to deliver. Gerald Marsh's wife asked who placed the IO, he said. She wants to thank you. Mara said nothing. I told her I'd pass it along. A pause that was not quite comfortable. The incident report is going forward. I want that to be clear. I understand. You made a unilateral decision in a critical situation without attending authorization. Yes. Another pause. His jaw moved slightly, the way jaws move when the next sentence is not the one that was originally prepared. You were also right, he said, and the words sounded like they cost something. Ben would have lost him. He knows it. I know it. He looked at her for another moment. That doesn't change the report. I know, she said. File it. He left. She watched the bay door swing on its hinges and settle back to still. Rosa was beside her again within seconds. What did he say? He said I was right and they're filing the report anyway. Rosa made a sound that was not quite a laugh. Classic Reese. He can't be wrong and he can't let anyone else be completely right either, so he finds a way to split the difference. She shook her head. What are you going to do? Mara considered the question in the way she considered most questions, which was to take it apart quietly and then put it back together. I'm going to finish my shift, she said. Then I'm going to go to the staff room and wait for the review. Then I'm going to go home. And after that? After that, I'm going to make dinner and sleep. She began moving toward the next chart. What else would I do? At 6:15, with 30 minutes left in her shift, the hospital's overhead PA system announced a trauma incoming. Motor vehicle versus pedestrian, 40 minutes out by air. The trauma team began their prep. Mara was pulling supplies when she heard Pratt's voice behind her, directed not at her, but at the nursing assistant standing near the supply cart, the volume once again calibrated for transmission. First shift and already caused 2 separate incident flags. I've seen travelers come through here, and I'm telling you, this one is a liability. The way she looks, the way she operates like she owns the place, administration is going to hear from me tonight. 1 more shift, maybe 2, and she's gone. The nursing assistant was a young man, maybe 22, and he was looking very hard at the supply cart. Mara did not turn around. She found what she needed, closed the cabinet, and walked back toward the trauma bay. She was not angry. That was the thing that would have surprised anyone watching from outside. She had moved past anger a long time ago, somewhere on the other side of experiences that made a charge nurse's administrative maneuvering feel like weather. Unpleasant, sometimes severe, but fundamentally impersonal. What she felt, if she named it honestly, was the specific tiredness of someone who has been through this particular configuration of events enough times to know exactly how it develops and exactly how it ends, and who is waiting, with patience that looks like passivity and is actually something else, for the part of the story that has not arrived yet. Her phone buzzed in her pocket. She checked it at the nurse's station. An encrypted message through the secure application she kept installed on her phone, out of habit. More than expectation, the kind of habit that stays with you the way certain kinds of training stays with you, residing below the level of conscious choice. The message was from a number she had not seen in 14 months. It contained 4 words and a timestamp. She read it twice. She put her phone away. She looked at the trauma bay doors in front of her. Her expression did not change, but something behind it did. A realignment, small and precise, like a scope being adjusted to account for distance. The kind of adjustment you make when you have just learned that the thing you were waiting for has changed from a possibility to a certainty. Outside, it had begun to rain. Through the narrow window above the supply alcove, she could see the parking lot lights coming on in the gray early evening, and she could see, though she had no particular reason yet to look for them, that the rain was coming in from the west, hard, sustained, the kind that settles in and does not move on quickly. She pulled on a fresh pair of gloves. She checked the clock. 30 minutes left in her shift. Then the review. Then home. She had been in worse positions than this with considerably less warning. The incoming trauma alert sounded again, 15 minutes closer now than the last update, and somewhere above the hospital, a sound that might have been wind-shifted and deepened into something with more deliberate rhythm. A sound that, if you had spent enough time in certain kinds of operational environments, you would not have mistaken for anything other than what it was. Mara heard it. She kept her eyes on the trauma bay door, and she kept working. The rotors were not whined. She had known it from the first pulse of sound through the supply alcove window, known it the way you know certain things, not through reasoning, but through the body, through the part of the nervous system that was trained, over years and in specific conditions, to sort sounds into categories before the conscious mind had finished forming the question. Civilian helicopters had a particular signature, higher pitched, less deliberate, the sound of utility. What she was hearing now had the low authoritative throb of military-grade rotors running at operational speed, and there were at least two of them, and they were not slowing down in the pattern of a standard medevac approach. They were circling. She registered this without breaking her preparation rhythm. Gloves on, bay stocked, suction checked, the incoming MVA pedestrian trauma still 12 minutes out, according to the last update from dispatch. The rest of the trauma team was moving around her in the focused pre-arrival choreography she had learned to work inside without disrupting. Rosa was setting up a second IV station on the left. The respiratory therapist, whose name Mara had learned was Donovan, was running a ventilator check in the corner. Dr. Reese had reappeared in his coat. His earlier conversation with Mara apparently filed somewhere it would not interfere with the clinical work, which was the one thing about him she had identified as functional. The PA crackled. Not with the soft chime of a routine announcement. With the flat, pre-scripted urgency that hospitals used when something had already been decided by someone above the administrative floor, and the announcement was not a request, but a notification of conditions already in motion. Attention all Harwick General staff. The facility is now under coordinated emergency protocol. All non-essential personnel please clear primary corridors. Security to main entrance. Repeat. Security to main entrance. Reese stopped moving. Across the bay, Donovan looked up from the ventilator. Rosa's hand paused on the IV kit. Mara kept working. She finished her supply check and moved her eyes once to the narrow window. The parking lot lights were still on. The rain still coming in hard from the west. And now, in the wet illumination from the lot floods, she could see the first of the black SUVs turning off the access road onto the hospital approach lane. Not one. 3. Moving with this compact precision of vehicles that had done this before in other parking lots, other facilities, following a route that someone had already driven in their head before they drove it on the ground. A fourth SUV followed, then a fifth. "What is that?" Donovan said. Not a question exactly. More like a man giving voice to something the room was already collectively thinking. "Security detail," Mara said. She did not look up from the chart she was completing. "Federal. For what?" She didn't answer because the bay doors opened at that moment, and two things happened at the same time. The trauma team lead, a senior nurse named Packer, who had been at Harwick for 9 years, and who wore the specific expression of someone holding together something that was beginning to come apart, walked in and said that the MVA case had been diverted to Mercy North because they were now receiving a priority federal transfer, and from the main corridor came the sound of boots. Not the soft-soled shuffle of hospital staff, but hard-soled, fast-moving, the sound of people who wore their footwear like equipment. The first agent through the secondary corridor door was a woman in her late 30s, dark jacket, earpiece, the kind of flat professional composure that does not get produced by calm environments. She was followed by two men who were built in the way of people who think about physical space differently from civilians. Always the widest point of the doorframe, always the angle that covered the most area. And behind them came a gurney moving at a pace that the orderlies were clearly struggling to maintain. On the gurney was a man. Mara did not know his name yet. What she knew immediately was the presentation. He was in his mid-60s, dressed in the remnants of clothes that had been cut away in the field, one hand restrained at his side as a precaution, oxygen mask already running, skin the color of old ash. His eyes were open, but the tracking was wrong. Moving in small, involuntary arcs, the kind of ocular movement that was not confusion and not sedation, and not simply shock. She had seen it before. She knew what it was, and she did not say so yet. The female agent stepped forward before anyone else could move. This facility has been designated for federal emergency medical care under Executive Medical Protocol. One of our field physicians will be present for consultation. No treatment decisions are made without our clearance. Reese took half a step forward. He was the most senior physician in the room, and he knew it, and that knowledge lived in every line of his posture. This is my trauma bay. Any patient who comes through that door is under my clinical authority. Dr. She looked at his badge. Reese, your facility has been federally designated. I understand that's an adjustment, but we have a protocol and we need you to work inside it. Your protocol doesn't override my medical license. It doesn't have to. Her voice had not changed in register or speed. We're not asking you to cede clinical decision-making. We're asking you to coordinate with our field physician before acting. That is a reasonable request in a situation you don't yet have full context for. A pause. Reese looked at the man on the gurney. Whatever argument he had been preparing made contact with the clinical reality in front of him and shifted. Fine, he said, but I need to examine him, now. The agent stepped back. Mara moved with the team to the bedside. This was her role, and she filled it. Monitoring, vital support, the functional work that kept the space around a physician operational. She watched the readouts as they came up, heart rate 118, irregular in a pattern she was cataloging. Blood pressure 88/50. Respiratory rate elevated. O2 sat at 91 and dropping with a slope that meant the mask was not going to hold it. Reese was running his assessment. She watched his hands and his face. I was a technically proficient physician. She had revised her initial read on him over the course of the shift and landed on this with a specificity she trusted. He was also working without context, which was the most dangerous position a clinician could be in, and she could see in the way his eyes moved between the patient and the monitors that he knew something was wrong with the picture and was not yet able to say what. What was he exposed to? Reese asked the room. The female agent, who had identified herself at some point in the last 4 minutes, a Special Agent Doris Keene, a name Mara had stored without appearing to, said, "Unknown substance. Field assessment suggested a possible chemical agent. That's all we have." Unknown is not a treatment plan. No, Keene said. It's not. Reese ordered a talk screen, ordered labs, began running through a differential that Mara tracked quietly, and that was, given what he had to work with, reasonable and wrong. Not catastrophically wrong. The kind of wrong that would have been right for 80% of the possible explanations, which meant it would have been fine if this patient was in the 80%. She did not think he was. The field physician arrived 4 minutes later, a young man named Haverford, late 30s, with the stiff posture of someone operating at the edge of his training and managing it poorly. He conferred briefly with Reese, confirmed the talk screen order, and suggested supportive care pending results. Standard. Defensible. Inadequate, if she was right about what she was looking at. She was watching the patient's hands. The fingers of his right hand were making small, rhythmic movements against the gurney rail. Not tremor, not the generalized shake of cardiovascular instability, but precise, almost intentional, isolated flexion in a pattern that went with exactly one thing in her differential and nothing else in any textbook Haverford had been trained on. She stepped back from the bedside. She went to the medication alcove. She did not take anything out. She stood for a moment with her hands on the counter and ran through the arithmetic one more time, checking her own reasoning the way she had been taught to check it in environments where being wrong had consequences that did not stay on paper. She was not wrong. She went back to the bay. Reese was issuing orders. Haverford was on a phone. Keene was standing at the door with the watchful stillness of someone managing a situation that was already past the edges of the plan. Dr. Reese, her voice was level. I need a minute. He didn't look up from the chart. Not now. The ocular movement pattern is not consistent with a general toxin presentation. It's consistent with a neuromuscular agent with a specific mechanism. She said it quietly, without heat, the way you say something that you know is going to land badly and have decided to say anyway. The treatment you're preparing will accelerate the paralytic cascade. He looked up then. The room did a thing rooms sometimes do, which is to become briefly quieter than the ambient sound level actually changed, as though the air itself is paying attention. That's a significant claim, Reese said. Yes. Based on what? She hesitated, not because she didn't have the answer, but because the answer was going to change the temperature in this room in a direction she had not planned on going today. Exposure, she said. Prior clinical exposure to this specific class of agent. Military context. Haverford looked up from his phone. Keen's head turned 2 degrees. Reese's expression was doing several things at once. "You're a travel nurse," he said. And it was not what he meant. She understood that he was not being dismissive in that moment, that he was trying to fit the information into a structure that would hold it, and the structure he had was the wrong shape. "Yes," she said, "and I've seen exactly this presentation twice before in operational settings, and both times the instinct to treat the cardiovascular signs first is what costs time. You have about 4 minutes before the respiratory muscles follow the pattern his fingers are already in." Silence. Haverford had lowered his phone. Keen had moved 2 steps closer to the group. Reese looked at the patient's hand. He looked at it for 3 full seconds. She watched him see it, the specific flexion, the rhythm. And she watched the moment it registered, not as confirmation of her diagnosis, but as the introduction of doubt, which in clinical medicine at the right threshold was sometimes the same thing. "What's the treatment?" he said. She told him. He listened to all of it. When she finished, he was quiet for a moment, and she could see him running it, checking it against what he knew, finding the places where it made sense, finding the places where it went beyond his frame of reference, and required him to take her word for something, which was not a position he was comfortable in. "That's not in any protocol I've got," he said. "No, it wouldn't be." Another pause. The monitor alarmed. O2 sat had dropped to 87. "If you're wrong, I'm not." She said it without defensiveness, just as a data point. "But if I am, the cost is a conversation about my credentials. If you're wrong, the cost is him." Reese looked at Haverford. Haverford spread his hand slightly, a gesture that meant "I don't have anything better," and looked at Keen, who looked at Mara with an expression Mara could not fully read, but that had stopped being hostile. "Do it," Reese said. She did it. The sequence took 7 minutes. It was not clean. None of the moments in this category of medicine were clean. They were all improvised and pressured and held together with training and timing and the specific stubbornness of not stopping when every instinct says the situation has already gotten away from you. Haverford assisted without being asked to, which she noted. Rosa appeared with supplies before Mara had to request them, reading the room with the practiced fluency of a nurse who had spent years learning what a resuscitation needed before anyone said it out loud. At the 11-minute mark, the patient's O2 sat had climbed to 94. At 14 minutes, the ocular movement had stabilized. At 18 minutes, his blood pressure was reading 101/62, and his respiratory rate, which had been climbing toward the dangerous end of the scale, had begun to fall back. The bay was quiet in a way that was different from the quiet earlier. That had been the quiet of people who had stopped breathing to watch something. This was the quiet of people who had just watched something and were not yet sure what to do with it. Reese stepped back from the bedside. He pulled his gloves. He looked at the monitors for a long moment. "Document everything," he said, to the room in general, and walked out. Haverford said quietly, "I've never seen a presentation like that outside of classified literature." He was looking at her with the expression of someone who has been standing in a room where a question they've always found theoretical just became practical. "Where did you—" "Documentation first," she said. "I need to chart this while the sequence is fresh." He nodded slowly and moved away. Keen was at her shoulder 40 seconds later. "Ms. Voss." Her voice was lower than it had been, the professional flatness recalibrated into something that was still controlled but differently weighted. "I need to understand your background. It'll be in my agency file." "I've seen your agency file." A beat. "It doesn't explain what just happened in there." Mara began writing her documentation. Her handwriting was small and precise, the kind of handwriting that meant you had learned to record things in conditions where space and light and time were all in short supply. "Your patient is stable," she said. "That's what happened." Keen looked at her for a moment longer, then stepped away to make a phone call in the corridor, and Mara could see through the bay window that she had moved to a position where she could speak without being overheard while still maintaining sightline to the room, which was a choice that said something about her training. The next hour was administrative turbulence. Pratt appeared at the bay entrance 20 minutes after the patient had stabilized, assessed the situation, and did not speak to Mara directly. Addressed everything to Packer, to Reese when he returned, to Haverford, moving around Mara in the particular way of someone who has just watched their position become complicated and is deciding how to renegotiate it. Reese was signing orders at the station. His jaw had the set of a man working through something he had not resolved. The incident report from that morning's I.O. placement was apparently still in process. Packer mentioned it in a tone of someone who was beginning to feel uncertain about the ground they were standing on, and Pratt confirmed it, and Reese said nothing. Rosa found Mara at the medication station at the end of the hour. "Keen's been in the administrator's office for the last 20 minutes, she said quietly. "And there are people in the parking lot who are definitely not from around here." Mara looked up briefly. "How many?" "I counted 8, in 2 groups, one by the south entrance, one near the loading dock." Rosa paused. "The kind of people who stand very still in the rain and don't look cold." Mara filed that. At 8:42, the administrator on call, a man named Whitfield who had the haircut and the manner of someone who had risen through hospital management by never being in the room when bad decisions were made and always being in the room when credit was distributed, came down to the trauma floor with Pratt and requested that Mara step into a conference room. Reese was there. So was Haverford. So, unexpectedly, was Keen, who was standing at the back of the room with the precise posture of someone who has been asked to attend a meeting and has decided to let the meeting proceed until it becomes necessary to intervene. Whitfield sat at the head of the table. Pratt sat to his left. She had a folder in front of her, which Mara observed contained printed copies of 2 documents she had not been shown. "Ms. Voss," Whitfield said, in the tone of a man who had rehearsed this in the elevator. "We've reviewed the events of today, and while we certainly appreciate a throat clear, a hand adjustment, the outcome in both cases, the manner in which you operated today, raises serious questions about your adherence to scope of practice, your willingness to function within a team structure, and your general suitability for this facility's environment." Mara sat with her hands in her lap and said nothing. "The incidents this morning and this evening both involve unilateral decisions made without attending physician authorization, and in the case of this evening's event, a claim of clinical expertise that is not reflected in your agency documentation." He looked at the folder. "We will be referring both incidents to the staffing agency and recommending an immediate review of your contract placement here." From the back of the room, Keen said, "That recommendation should go on hold." Whitfield looked up. Keen walked forward. She placed a small card on the table in front of Whitfield, not showing it to the room, just to him. He looked at it. Something moved behind his eyes. "The patient Ms. Voss treated this evening," Keen said, in the same level voice she used for everything, "is a federal official under protective protocol. The treatment she administered prevented what our medical consultants have now confirmed would have been a fatal respiratory failure within 8 to 12 minutes. She looked at Pratt, then at Whitfield. "The federal government has an interest in the circumstances of care provided tonight. That interest extends to any personnel actions that affect the individuals involved." Pratt said, "This is a hospital administration matter. It's not—" "I understand that's how you'd like to frame it," Keen said. "I'm telling you how it's being framed from our side." She did not raise her voice. She did not need to. "Ms. Voss's contract is not being terminated tonight. Her file will not be escalated to the agency pending the conclusion of our investigation into this evening's incident. If the hospital's administration has concerns about her conduct, those concerns can be submitted in writing to the number on that card, and they will be reviewed in context." She picked the card back up. "That's all." Whitfield looked at the table. Pratt's face was the particular still of someone whose argument has been removed from her hands without anyone raising their voice. Reese had said nothing during any of this. He was looking at his own hands, which were flat on the table in front of him. Mara stood. "Are we done?" she asked, to no one in particular. Nobody answered, which she took as yes. She walked out of the conference room, down the corridor, and back toward the staff room to collect her bag. The hallway was quieter than it had been all day. The evening shift had absorbed the volume, the federal agents had pulled back from the primary corridors, and the particular agitated energy that had lived in the building since the SUVs arrived had not gone away, but had redistributed into something lower and more watchful. Rosa was waiting at the staff room door. She did not look like someone who had been casually passing by. Keen's assistant asked me what unit you worked before you came here, Rosa said. What did you tell her? I told her I had no idea. Rosa paused. Which is true, but I also told her that whatever it was, this floor was lucky you were on it today. Another pause. She wrote it down. Mara opened her locker, retrieved her bag, and slung it over her left shoulder. Go home, Rosa said. Get some sleep. Whatever's going on with those people, it's not finished. I know. You know more than you're saying. Mara zipped her bag. Everybody knows more than they're saying, she said. That's just how days like this work. She walked out through the side exit, the one that came out near the loading dock, not because it was shorter, but because she had noted earlier that it offered a better line of sight across the south parking lot before you were in it. Old habit. She couldn't turn it off. What she saw when she pushed through the door into the wet night air was not what she expected. The south parking lot was still occupied. One of the black SUVs remained, engine running, its lights off but visible in the ambient glow of the lot floods. The two agents she had seen out here earlier, Rosa's people who stood still in the rain, were gone. In their place, standing alone about 20 feet from the hospital entrance, was a man. I was in his 60s. Tall, with the slightly forward lean of someone who had spent a long career being listened to and had stopped needing to perform authority because it had simply become structural, part of how he occupied space. He was wearing a coat, not a jacket, and his clothes were too good for the rain and not good enough for the occasion he seemed to be dressing for. She had never seen his face, but she had read his file in a context she was not currently going to think about, and she had seen photographs, and she had been told once, in a room with 3 other people and no windows, that this man was the reason certain things she had done in certain places would never appear in any document that could be retrieved. He was looking at her. She stopped walking. The rain came down between them, and the parking lot light made the water silver. Somewhere above the building, one of the helicopters was still in a holding pattern. She could hear it, the low authoritative pulse of it, present but not approaching. The man took 3 steps toward her. He stopped at a distance that was conversational but not casual. Captain Voss, he said. Her rank, not her current title, not the name on her badge. He said it the way you say a thing that you have been waiting to say for a specific amount of time, with a specific reason, and the time has come, and the reason has arrived in the form of a stabilized patient in a trauma bay and a parking lot in the rain in Delport, Washington. She had not been called that in 4 years. She looked at him. She let the silence sit for exactly as long as it needed to. You should be upstairs recovering, she said. I discharged myself 15 minutes ago. The ghost of something moved across his face that was not quite a smile and was not quite relief. They were very upset about it. You almost died. Yes, he said simply. You prevented that. Again. The word again landed in the space between them and stayed there. The rain intensified slightly, drumming against the roof of the SUV behind him, running off the edge of the hospital's concrete overhang above her in thin silver lines. She was aware of the weight of her bag on her shoulder, the dampness starting at the collar of her jacket, the fact that her feet hurt from 12 hours of shift, and she had not eaten since the lunch she'd taken alone in the staff room. She was also aware, in the way you are aware of a door that has just opened into a room you had sealed, that the 4 words in the encrypted message she had received 3 hours ago had not been a warning. They had been a confirmation. He's already en route. She looked at the man standing in her parking lot, in the rain, with his coat getting wet and his face carrying something she did not yet have a word for. Gratitude, maybe, or the particular expression of someone who has owed a debt for so long that paying it has become its own kind of burden. You should go back inside, she said. Keen is going to be furious. Keen is always furious, he said. It's her most useful quality. He took one more step toward her. I need to tell you some things, Captain. Not tonight. You're exhausted, and I need another hour before they'll let me stand without someone making a face about it. But soon. I have a shift tomorrow. I know. Something shifted in his expression. They're going to try to terminate your contract in the morning, before I can intervene through proper channels. She had already known this, or not known it exactly, but had the shape of it, the outline, Pratt's expression when she left the conference room, Whitfield's careful lack of eye contact, the folder with the printed documents she had not been shown. Let them try, she said. He looked at her for a long moment, the rain coming down between them, the helicopter still circling somewhere above in the dark. "You're not going to fight it," he said. And it was not a question. He was reading her the way people read you when they have spent years in rooms where the ability to read people correctly was not optional. "I'll be here in the morning," she said. "What happens after that happens?" He nodded slowly. Then he said very quietly, "The people in that hospital have no idea what they've had on their floor today." "No," she said. "They don't." She adjusted her bag strap, looked at him once more, and turned toward the parking structure where her car was. Behind her, she heard him say her name again. Not the rank this time, just the name. And she stopped without turning around. "There's a second agent in the building," he said. "Not one of ours. Someone came in during the chaos of the intake. We think they were there for a reason that had nothing to do with providing medical care." She stood very still. "We don't know who sent them," he said, "or what they were waiting for." The rain fell. The helicopter's rhythm shifted above them, not landing, not leaving, recalibrating, holding its position with the patient precision of something that had been tasked with watching and intended to keep watching until it was told otherwise. She turned around. "Which floor?" she said. "Third floor," he said. "East wing. We lost visual 12 minutes ago." She was already moving, not running. Running drew attention and attention in a building with federal agents and unknown actors, and a staff that was already operating at elevated anxiety was a variable she didn't need. She walked fast, with the particular economy of someone who had learned that pace and direction conveyed authority more reliably than speed, and she pushed back through the side entrance and into the corridor before the door had finished swinging behind her. The third floor east wing was post-surgical recovery. She knew this because she had done her building walk during the first 30 minutes of her shift. Old habit, non-negotiable, the kind of thing that looked like idle curiosity to anyone watching, and was in fact the same impulse that made her count the rotors and note the parking lot positions. She had not known, at 7 this morning, why she was doing it. She knew now. The stairwell was faster than the elevator and gave her a better read on the building's current state. She took the stairs at the third-floor landing and pushed through into the east wing corridor and immediately read the room. 2 nurses at the station, one on the phone, one charting. A patient family member asleep in a chair near room 312, the overhead lights at their standard evening level, and at the far end of the corridor near the supply room door, a man she had not seen before. He was in scrubs. Dark blue. Harwick General used seal blue. It was close enough that you would not catch it in a quick glance, which meant it was deliberate. I was standing with a tablet in one hand, looking at it with the posture of someone performing casual purposefulness. And Mara clocked 3 things in the 2 seconds before she looked away. The scrubs were the wrong shade, the tablet was not on, and he had not looked up when she entered the corridor, which was what people instinctively did when a door opened behind them. Training, suppressing that instinct, took time and repetition. You didn't get it from working post-surgical recovery. She went to the nurse's station. The nurse on the phone was still talking. The one charting looked up. Her badge read T-OSE, RN, with the mildly questioning expression of someone who did not recognize Mara as East Wing staff. "I'm trauma rotation, down from the incident tonight," Mara said, keeping her voice low and easy. "Agent Keene asked me to do a floor check. Anyone come through here in the last 30 minutes who wasn't on the shift roster?" Ose looked at her for a moment, then at her badge, then made the calculation that the evening had been strange enough that this was within the range of plausible. "Maintenance guy," she said he was checking the backup power conduits in the supply room, but I didn't call maintenance. "Did you check with facilities?" "I was going to." She looked toward the end of the corridor. "He's still in there." Mara said, "Call Keene. Not the main desk. Ask for the federal agent in the administrator's office on 2. Tell her East Wing supply room, 3rd floor." She said it in the same register she used for medication instructions. Clear, specific, no editorializing. "Do it now, quietly." Ose picked up the phone. Mara walked toward the supply room. She did not have a weapon. She had not carried one in 4 years and was not carrying one now, which was a calculation she had made when she took the Harwick contract and which she was currently reassessing. What she had was the building, the layout she had memorized at 7 this morning, the knowledge that the supply room had 2 entry points, the main door and a secondary access hatch in the back wall that connected to a linen cart corridor. and she had the advantage that he did not know she was coming specifically for him. She knocked on the supply room door. It was not a hesitant knock. It was the knock of someone with a reason to be there. A 3-second pause. Then the door opened. Up close, he was younger than she had read from down the corridor. 30, maybe 32, with the kind of unremarkable face that was itself a form of deliberate construction. Nothing that stood out, nothing that caught. His hands were empty. His eyes moved to her badge, to her face, to the corridor behind her in a sequence that took less than a second and told her everything she needed to confirm. "Supply requisition," she said. "Trauma sent me up for extra chest seals. We burned through our stock tonight." A beat. "I'm just finishing up in here." "Shouldn't be long." She stepped forward into the doorway, not crossing the threshold but occupying it. Close enough that he would have to either let her in or make the decision to block her, and either decision would tell her something. He stepped back. She came in. The supply room was standard. Metal shelving units on 3 walls, a utility sink, the backup power conduit panel on the north wall with its cover plate already removed and replaced, the seams slightly misaligned. He had been in here long enough to do something. She did not look at the panel directly. She looked at the shelving nearest the door and began scanning labels with the practiced speed of someone who actually wanted chest seals. "Long night," she said. "Yeah." His voice was controlled. "You here for the federal thing? Everybody got pulled in." She was scanning shelves. "I've been down in trauma since 5. "Facilities," he said. "They called us in for the power check, federal protocols when they used the building." "Makes sense." She found the chest seals, they were actually here, and took 2 packages, because she had said she would and not taking them would be a data point. She turned toward the door. "All good up here?" "All good," he said. She walked out. She did not go back to the nurse's station. She went to the stairwell door, pushed through, and then stopped on the landing and pulled out her phone. She sent a text to the number from the encrypted message. 4 words, mirroring the economy of the original. Supply room, panel, east. She put the phone away and went back up the corridor because she needed to be visible and accounted for when whatever happened next happened, and because leaving the floor now would mean leaving Ose and the overnight staff without someone who understood the geometry of the situation. Keene arrived on the 3rd floor 6 minutes later with 2 agents she had not seen before. They went past the nurse's station at a pace that was fast without being a run, and Mara, standing at the end of the corridor with the chest seal packages in her hand, watched the supply room door open and watched the man in the dark blue scrubs come out into the corridor and saw the moment his face changed. It was a small change, just a tightening around the eyes, a recalibration, the face of someone who has run a calculation and arrived at an answer they did not plan for. He looked down the corridor and he saw Mara standing there with the chest seals, and he understood, all at once, and without any ambiguity, what had happened. She held his gaze for 1 second. Then she looked away, because there was nothing else to say with it, and she was not in the business of gloating, and because Keene had it from here. She went back downstairs. Rosa was at the trauma bay when she got back, which meant Rosa had not gone home either, which meant Rosa was either very dedicated or very curious, and Mara's read was that it was a specific mixture of both. She was restocking the bay with the focused efficiency of someone with somewhere to be her hands while her mind worked. "You went back in," Rosa said. Not accusatory, just observing. "Supply run." Mara set the chest seals on the cart. Rosa looked at them, looked at her. "We're fully stocked." "I know." Rosa absorbed this, turned back to her restocking. After a moment, she said, "The man from the parking lot, the one in the coat, he came back inside 20 minutes ago. They took him up to a private room on 4. A pause. Keene looked different when she came back down. Different how? Like someone who'd been given information that changed the shape of something. Rosa smoothed a package of gauze flat against the cart shelf. "What's happening, Mara?" Mara considered the question. Not the answer. She knew roughly what she would and would not say, but the question itself, the fact that Rosa was asking it, the fact that Rosa had stayed and was asking and deserved something honest. "I don't know the full shape of it yet," she said, "but it's not done." Rosa nodded slowly. "Are you in danger?" "I don't think so. Not tonight." "But you thought about it." "I think about most things." Mara picked up the chart she'd left unfinished and turned to the monitor station. "Go home, Rosa. Seriously. You've been here 12 hours. 13, Rosa said. But who's counting? She pulled off her gloves, balled them, tossed them toward the waste bin, and missed by 4 inches, which she looked at for a moment with the expression of someone who has decided to let that be a metaphor and then decided not to. She picked them up and put them in the bin properly. I'll be back at 7. I know, Mara said. After Rosa left, the trauma bay settled into the specific night shift quiet of a department between crises. Monitors running, the low conversation of the overnight staff out at the station, the building asserting itself through ambient sounds that daylight crowds out, the HVAC, a distant elevator, the particular creak of the east stairwell door that she had catalogued at 7 this morning. She finished her documentation and submitted it and sat for a moment at the station with her hands flat on the desk. The man upstairs in the private room on 4 had called her captain. He had said again. She had not let herself think about what that meant, in the moment, because the moment had not had room for it, and now the moment was over and the thinking was still not something she was ready to do in full. She filed it the way she filed other things that required processing she didn't currently have capacity for, present, acknowledged, deferred. What she had capacity for was the panel in the supply room, what had been done to it, what it meant for the building's systems and for the federal official 3 floors above, and whether Keene's team had the technical knowledge to assess it correctly, or whether they were going to look at a piece of tampering that was designed to look like a power compliance check, and read it exactly the way it was designed to be read. She picked up the phone at the nurse's station and called the number on 4. Keene answered on the second ring. The panel, Mara said. Has your tech looked at it yet? A short pause. They're assessing now. Tell them to check the secondary junction on the east side of the board. Not the conduit he touched, the one next to it that looks untouched. Another pause, longer this time. Why? Because if I was doing what I think he was doing, the visible work is cover. The actual work is in the secondary junction, and it's designed to activate on a specific current draw. She kept her voice at a flat informational register. The current draw from a room running full medical equipment, like, for example, a private room on 4 with a patient on monitoring. The pause that followed this was the longest yet. Hold, Keene said, and put her on hold without waiting for a response. Mara held. She looked at the ceiling of the nurse's station. There was a water stain in the upper right corner of one tile, old, the color of weak tea. Someone had written a small note in pencil on the edge of the tile above the stain, fixed, 314, J. J had been optimistic. Keene came back on. How certain are you? Enough that I'd move him before your tech finishes the assessment rather than after. A 3-second silence. We're moving him, Keene said, and hung up. Mara put the phone down. The board overhead ran its standard overnight chime, the soft triple tone that marked medication rounds. And the night shift nurses moved through the corridor with the steady, unhurried pace of people doing work that does not wait for dramatic moments to pause. A man came in through the main entrance with a laceration above his eyebrow that had bled impressively and was ultimately less serious than it looked. Mara triaged him, cleaned the wound, applied closure strips, and sent him on his way with aftercare instructions he would read twice and follow approximately half of. Normal. The work was normal, and she let herself be in it. At 11:40, Dr. Reese appeared in the trauma bay doorway. She had not expected him. His shift had ended at 9, and he had no administrative reason to be here now, and he was not in his white coat, which meant he had not come back to work. He was in a jacket over a collared shirt, which meant he had left and come back, and his hands were in his pockets, which was the posture of a man who is not sure what to do with them because he is not sure what he came to say. She looked up from the chart she was reviewing. She waited. The man upstairs, he said. The federal patient. What about him? Haverford told me who he is. He came into the bay, stopped near the equipment cart, did not lean on it. He told me the title anyway. I looked up the rest. He paused. I've been in medicine for 16 years. I've seen a lot of things. I know. I haven't seen what you did tonight. He said it without embellishment. With the presentation, the agent class, I've read about that class of compound. In classified literature. Once, as part of a DoD consultation 4 years ago. He looked at her directly. Where do you have clinical exposure to it? She considered how much of this to answer. She had learned, over a long career of working in the intersection of medicine and things that did not appear in medical literature, that the truth was often the most efficient option. Not all of it, not the classified edges, but the structure of it, the frame. Overseas, she said. Military context. I can't be more specific than that. How long were you in? Long enough. His jaw moved. He was deciding something. The incident report from this morning, he said. The IO placement. I'm pulling it. She looked at him. Ben agrees. He's not happy about agreeing, but he agrees. He held her gaze. You were right, and the report was going to be an inaccurate document. I don't sign inaccurate documents. She said nothing for a moment. Then, Pratt's escalation? Is Pratt's problem? His voice was flat. I'm not part of that recommendation. She nodded once. He nodded back. It was not a warm exchange. Warmth was not what either of them had been operating in today, and manufacturing it now would have been dishonest in a way that would have made the whole thing smaller than it was. He left. At 12:15, Keene came down. She moved through the trauma bay doorway with the brisk purpose of someone who has been making decisions rapidly for several hours and has arrived at the part of the evening where some of those decisions require a conversation. She pulled a chair from the wall and sat, which surprised Mara. Keene had been standing for everything up to this point, and sitting meant she intended this to take a few minutes. The secondary junction, she said. You were right. What was it? Remote interrupt. Set to trigger on a specific load pattern. Sophisticated, the kind of device that takes time and access to place, which means the supply room wasn't the first opportunity. He'd been in the building before. She looked at her hands briefly. We have a problem with the intake process. That's not your problem. But I want you to know we found it. The patient? Moved. Secure. A pause. Because of your call. Mara nodded. Keene leaned forward slightly. I've spent the last 3 hours reading what I can access about you, which is less than I'd normally be able to access, which itself tells me something. She said it without accusation, just observation. The man upstairs wants to speak with you in the morning, before the hospital's administrative review. What time is the review scheduled? 8. He wants to see you at 6:30. I'll be here at 6. Keene almost smiled. It was a very small movement. He said you'd say something like that. She stood, pushed the chair back to the wall. For what it's worth, and I recognize this is a strange thing to be told by a federal agent at midnight, what you did today was exceptional. Both things, the medical work and the other thing. I was doing my job, Mara said. Both times. Yes, Keene said. That's what makes it exceptional. She moved toward the door. 6:30, 4th floor, east. Ask for room 412. She left. The night moved through its remaining hours with the texture of nights that have already contained too much and are now simply fulfilling their remaining obligation of time. Mara worked her patience, maintained her documentation, drank 2 cups of coffee that she did not particularly want but that her body required, and did not think about 6:30 more than was necessary. At 3 in the morning, the building was at its quietest. The particular stillness of a hospital between one shift's exhaustion and the next shift's arrival, the lull that felt like the whole structure was breathing slowly. She was at the station when the trauma bay doors opened and the overnight charge, not Pratt, a night shift supervisor named Aldrich, who had the low drama competence of someone who had survived many difficult shifts through sheer refusal to personalize any of them, looked in on his way past. You're still here, he said. I am. You've been here since 7. I have. He looked at her for a moment. Get a few hours in the staff room. Cots available. I'll pull you if anything comes in. It was a reasonable offer, and she was tired enough that refusing it would have been pride rather than judgment, so she took it. She set an alarm for 5:30 and lay down on the staff room cot with her bag under her head and her shoes still on, the way she had slept in many places over many years, and she was asleep in under 4 minutes. She dreamed briefly about a road in a country she would not name even in her own memory, and about the sound that a structure makes when it comes apart from the inside, and about the weight of 2 people she had carried, one over each shoulder. For a distance she still could not calculate because she had stopped counting at some point and just walked. She woke at 5:28, 2 minutes before her alarm, which was also an old habit. She washed her face at the staff room sink, retied her hair, checked her phone, 2 messages from a number she didn't recognize, both in the last hour, both from the same blocked sender, both containing only a string of numbers she recognized as a grid reference format she had not seen used in 4 years. She memorized them and deleted both messages and stood for a moment looking at the blank screen. Whoever had been in the supply room last night had friends who were not in federal custody. She put her phone in her pocket and went upstairs. Room 412 was at the end of the 4th floor east corridor, which was quieter than it should have been for a general medical floor. The rooms on either side were empty, which was not an accident, and there was an agent she hadn't seen before at the corridor junction who clocked her badge and her face and stepped aside without speaking. Keene was outside the room door. She looked like someone who had not slept, but the way she had not slept was organized, the kind of alert tiredness that runs on operational necessity. "He's been up since 4, Keene said. "He's going to push it too hard. I've told him that." "Has it worked?" "About as well as it usually does." She opened the door. The room was a standard private medical room. Bed, monitoring equipment, window looking east where the sky was beginning to make the slow concession toward gray that preceded dawn. The man in his bed was propped up at roughly 45 degrees, which was more upright than post-treatment guidelines would have recommended, and which he clearly did not intend to discuss. He had color now, real color, not the ashen gray of last night. His eyes were sharp. "Captain Voss," he said. "Sit down." There was one chair in the room. She sat. "My name is Warren Aldgate," he said. "You know the title." "Yes." "Then I won't waste time on it." He shifted slightly, and she saw the brief, tight expression of someone managing pain they have decided not to mention because mentioning it would change the conversation's balance, and she noted it and said nothing. 7 years ago, in a location that doesn't appear in any document, you kept 4 people alive for 9 hours under conditions that I am not going to describe in this room. She looked at him steadily. She did not confirm or deny it because there was nothing to confirm or deny. He had been there, in a manner of speaking, and what he was saying was accurate, and accuracy did not require her commentary. 2 of those people have gone on to do work that has had direct impact on national security outcomes, he said. One of them is currently in a position where her continued function depends on information she gathered in a window that would have closed permanently if you had made a different decision on a hillside at 2 in the morning. He paused. I am telling you this because you have never been told the downstream of what you did, and you should know it. The room was quiet for a moment. Outside the window, the gray at the horizon had begun to separate from the dark above it. You were medically discharged, he said. Burns, neurological sequelae from the blast exposure. Your record was sealed at your request. Yes. I've been trying to locate you for 14 months. She looked at him. I wasn't hiding. No, he said. You weren't. You were working, which is a different kind of invisible. Something moved in his expression. Not quite regret, but adjacent to it. The discharge was a bureaucratic failure on top of a medical reality, and I should have intervened before it became final. I didn't, and I have thought about that. He said it plainly, without performance. I'm saying it now because I don't believe in deferring that kind of thing. She was quiet for a moment, then, Why am I here, Mr. Aldgate? Not in this room, in Delport. He looked at her carefully. What do you mean? I mean, the message I received last night wasn't a coincidence. The grid references I received at 3 this morning weren't a coincidence. She held his gaze. What is actually happening? The shift in his expression was small and would have been invisible to anyone who had not spent years reading rooms. It was the expression of someone who has been found out, not in a shameful way, but in the way of someone whose plan has been assessed accurately before they were ready to present it. You're faster than I remembered, he said. What is happening? She said again, with the same flat precision. He reached for the water glass on the bedside table, drank, set it back. There is a secondary target, he said. The device in the supply room was not the primary operation. It was a contingency. If the first attempt failed, which it did, the secondary junction would have created a situation in which the building's emergency protocols would have moved the patient to a location that was easier to access. He looked at her. Someone planned this over weeks. Multiple entry points. Multiple contingencies. Who is the secondary target? He looked at her for a long moment. You, he said. The word landed in the room, and Mara sat with it and did not look away from him, and did not speak for 3 full seconds, which was the amount of time she needed to run the grid references against her memory of the surrounding geography and understand, all at once, what the numbers had been pointing at. Not a location he was giving her, a location someone else had already identified. Her apartment. 12-minute walk from the water. The one she had chosen because it was quiet and it was near the coast, and she had not lived near water in 4 years. She was on her feet before she had finished the thought, and Aldgate was saying something behind her, and Keene was opening the door from outside with the expression of someone who had just received a communication through her earpiece, and in the corridor the agent at the junction was moving, and Mara was already past him, already calculating the stairwell versus the elevator and choosing the stairwell, already moving at the pace she had not moved at since a hillside at 2 in the morning 7 years ago, in a location that did not appear in any document. Her phone buzzed in her pocket. She pulled it without stopping. Another blocked number. One message. Not grid references this time. A photograph. Her apartment building, taken from street level, time-stamped 40 minutes ago, the lights in her third-floor windows visible and burning, which was wrong because she had turned them off when she left for her shift yesterday morning. She was certain of it. She was always certain of it. It was the kind of thing she was always certain of. Someone was in her apartment, and they had sent her the photograph, which meant they wanted her to know, which meant they wanted her to come, which meant the apartment was not the objective. She was. She stopped at the stairwell landing, one hand on the door, and looked at the photograph again. In the lower right corner of the frame, almost too small to catch, was a partial reflection in the glass of the building's front door. Not the photographer. Someone standing behind the photographer, slightly to the left. She enlarged the image as far as the phone's resolution would allow. The reflection was blurred, but the shape was identifiable. The height, the posture, the specific way the shoulders were set. She had last seen that posture in a corridor 6 years ago, in a building that no longer existed, belonging to a person who, according to every official record she had ever been shown, was dead. Her hand tightened on the phone. Keene pushed through the stairwell door behind her and stopped when she saw Mara's face. "What?" Keene said. Mara turned the phone toward her. Keene looked at the photograph, looked at the reflection, looked at Mara. "Who is that?" she said. Mara looked at the image for one more second. Then she put the phone in her pocket and pushed through the door and started moving. "Someone who shouldn't exist," she said, and kept moving. Keene was on her radio before Mara hit the second landing, calling it in with the compressed efficiency of someone translating a situation into operational language, while simultaneously running to keep up with a person who moved like the stairwell was already familiar, like she had already calculated every step. Mara heard fragments. Possible hostile at secondary location. Subject is mobile. I need units at... And then she was through the ground floor door and into the corridor, and she stopped. Not because she had lost her direction, because running to her apartment was exactly what the photograph was designed to make her do, and she had taken 8 steps down that road before the older, more durable part of her training had caught up with the reactive part and put a hand on its chest. She stood in the corridor and breathed for 3 seconds. The photograph was bait. The reflection was bait inside the bait. Something specific enough that only she would recognize it, designed to produce a precise emotional response in a precise person. Whoever had sent it knew her well enough to know what that reflection would do to her. That level of knowledge did not come from a file. It came from proximity, from time spent in the same operational environments, reading the same person's reactions, which meant the reflection was real, the person was real, but the meaning of the image was constructed. She was meant to see the face and move without thinking. She had almost done exactly that. Keene came through the stairwell door and stopped when she found Mara standing still in the corridor. She had her hand on her earpiece, and her expression was the controlled urgency of someone managing 3 things at once. "Units are moving to your address," Keene said. "Tell them to approach passive. No lights, no sirens. If someone is there and they hear response units coming, we lose them." She turned to face Keene. "And I need everything you have on a man named Dorian Kaas, Kaas. He was attached to a joint intelligence unit operating in the Caucasus region approximately 6 years ago. His death was reported in an after-action summary that I now believe was falsified." Keene looked at her steadily. "You recognized him from a partial reflection?" "Yes." "From 6 years ago?" "Yes." A beat. Keene made the judgment call that the situation required. It was visible in the 2 seconds of her face before she clicked her radio. I need a records pull. Priority. Name Dorian Kaz. Possible intelligence attachment. 6-year-old KIA report. She looked at Mara while she said it. If this is real, it's real. Then we have a problem that's larger than one man in your apartment. I know. Mara started walking, not toward the exit, but toward the administrative corridor on the ground floor. I need to talk to Aldgate. Before your units reach my building and before whoever is watching this building sees the response pattern and understands that I didn't take the bait. He needs to rest. He'll rest later. This changes the shape of what he told me. She kept moving. Someone knew he was coming to Delport. Someone knew which facility he'd be routed to. Someone knew I was here. She turned a corner. That's 3 layers of penetration into a protected operational movement. That doesn't happen from the outside. Keene's stride did not break, but something in her posture shifted, a tightening, a recalibration. She clicked her radio again, and this time her voice was lower. Lock down the 4th floor. Nobody in or out of 412 except cleared personnel. I mean nobody. They went back up in the elevator because speed mattered less than arriving without the sound of stairwell doors. The 4th floor had 2 more agents than it had 20 minutes ago. Keene had called them in while Mara was still moving, which confirmed Mara's revised read on her. She was fast. She trusted her own assessment of a situation, and she did not need to be the most important person in the room to function at full capacity. Aldgate was not surprised to see them come back. He had moved to sitting fully upright, which he had not been when she left, and his monitoring leads were disconnected from the bedside unit, which they were not supposed to be. He looked at Mara's face and read it with the speed of a man who had spent his career in rooms where faces were primary data sources. Sit down, he said again. Dorian Kaz, she said. The name landed. She watched it land, watched his expression do something she had not seen it do in the hours she had spent in this room, which was to lose, briefly, its composed operational surface. Underneath was not panic. It was something older and heavier. The look of a man who has been carrying a specific piece of information and has just been told by someone else's certainty that the weight of it was justified. You've seen him, he said. A photograph. 40 minutes ago, at my building. She stood at the foot of his bed. Your after-action report listed him as KIA. Blast event, no recoverable remains. That's what the report said. Is that what happened? A long pause. Aldgate reached for his water glass, and this time she noticed that his hand was not quite steady, and it was not the residual toxin effect that had been in his right hand last night, and this was his left. This was something else. The after-action report was accurate as of the information we had at the time, he said carefully. That's a different answer. Yes, he said. It is. He set the glass down. 18 months after the event, we received intelligence suggesting Kaz had survived. The blast had been staged. His blast. He had resources inside the network that we didn't know about, and he used them to create an exit. He looked at the window. By the time we confirmed the intelligence, he had been outside our reach for over a year. The decision was made to maintain the KIA designation and pursue through other channels. Who made that decision? It went up the chain. Several people signed off on it. A pause. I was one of them. And you didn't think to tell me this when you found me 14 months ago. I didn't have confirmation he was operational, or that he knew about you specifically. His voice was even, but underneath it was the specific texture of a man delivering an honest accounting of a decision he made that he would make differently now. I made a calculation that the risk to you from knowing, the behavior changes, the visibility, outweighed the risk from not knowing. I was wrong. I have been wrong before, and I will be wrong again, and that does not make this particular wrong acceptable. The room was quiet. Keene, standing near the door, said nothing. She was giving Mara the room to receive this, which was a perceptive enough call that Mara noted it even now. Why me? Mara said. Not why is he after me? Aldgate had already told her she was a target. She meant the deeper version. Of the 4 people from that operation, why is the priority me? Aldgate looked at her steadily. Because you're the one who found the discrepancy in his original file. Before the operation. You flagged it to command and it was overridden, and then the operation went forward anyway, and then it went wrong in exactly the way you said it would. He paused. You were the one person in that chain who was documented as having known he was a risk before he became one. If that documentation surfaces, it buries him, she said. Whatever cover identity he's running now, whatever institutional protection he's rebuilt, a pre-existing flag on his record filed by a decorated military medical officer, kills all of it. Yes. And that document is in my sealed file. Yes. She stood with this for a moment. Outside the window, the sky had continued its transition. The gray was warmer now, beginning to carry the faint suggestion of color at the horizon, the first indication that the night had a limited remaining term. He's not at my apartment, she said. Aldgate looked at her. He sent the photograph to move me, to get me out of this building and into open ground where he has the advantage of preparation. She turned to Keene. What's the status of your units at my address? Keene pressed her earpiece. On site. Passive approach. Building is quiet. No movement on the third floor. Lights are on. She listened for another second. They're going in. Tell them to check the window locks before anything else, specifically the north-facing window in the main room. She met Keene's eyes. If Koss was in that apartment, he wasn't waiting to be found. He was leaving something, and he'd want a secondary exit confirmed before he sent that photograph. Keene relayed it. A 30-second wait. North window lock is broken, Keene said. Recent, clean cut on the interior latch. Is there a device? Another wait, longer this time. Sweep team is going through now. Keene's face was the flat professional mask of someone receiving information in real time and processing it without expressing it. 10 seconds. 20. Affirmative, under the kitchen counter. They're calling in EOD. The room absorbed this. Aldgate said quietly, he wasn't trying to kill you at your apartment. No, Mara said. The device isn't for me. I was never going to be at my apartment. If I'd gone there directly, I would have scoped the building first. He knows that. She turned the logic over, checking it. The device is for whoever he expected would respond to a report of a break-in at my address. It's for the units, creating a scene, creating chaos, drawing resources away from this building. Keene was already on the radio. Pull back EOD to safe distance. Do not enter the kitchen until... And then she was in full operational mode, voice low and fast, and Mara stepped back and let her work because Keene's machinery was running correctly, and Mara's job right now was not to run the response. It was to think 2 steps ahead of someone who had been thinking ahead of everyone else in this situation since before the first SUV pulled into the Harwick General parking lot. She looked at Aldgate. He's going to come here, she said. This building is secured. He was inside this building last night, in the supply room, with enough time and access to place a sophisticated device on the power panel. She said it evenly, not to alarm him, but because the accuracy of his understanding of the situation affected the quality of the decisions that would come out of this room. He has a floor plan, he has timing, and he now knows I didn't go to my apartment, which means he knows I made him, which means his window is closing and he is going to accelerate. Aldgate looked at her with the expression of a man who is recalibrating and is disciplined enough to do it quickly. What do you need? I need your authorization to access my sealed file, the specific document, the pre-operation flag. He looked at her for a half second. You want to use it? I want it available. If we bring him in and there's a question of what he has and what we can prove, I want that document in the room. She held his gaze. And I want it pulled by someone above the classification level of anyone he's currently compromised. Because if he got into this building and got to your transport routing, he has reach into the lower tiers. That's a significant accusation. It's a significant situation. Another half second. Then Aldgate reached to the bedside table and picked up the secure phone that Keene's team had placed there when they moved him to this room. And he made a call. And the call lasted 90 seconds. And when he put the phone down, he said, It's being pulled. 40 minutes. Thank you, she said. She left the room and stood in the corridor and looked at the ceiling for a moment. Not in defeat, just in the way you look at a fixed point when you are organizing a large number of moving variables into an order that will hold under pressure. The agents at the corridor junction were on radios. Keene was still working through the evacuation logistics of the device situation. Somewhere below her, the hospital was beginning its morning transition. The night shift winding down, the day shift arriving in the parking lot in 1s and 2s, the building's metabolism beginning to lift toward its daytime register. In approximately 2 hours, the hospital's administrative review was scheduled. In that review, without Reese's incident report and without Aldgate's intervention, Pratt's recommendation would have carried the day, and Mara's contract would have been terminated before 9 in the morning. That machinery was still running. Pratt did not know yet that Reese had withdrawn, did not know the shape of the night, and would arrive for her 8 o'clock meeting with the administrator carrying a folder and a conviction and a prepared statement. Mara considered this. Then she went downstairs because there was work to do and because standing in corridors was not how she operated. Rosa arrived at 6:50, which was 10 minutes before her shift, and came through the staff entrance and found Mara at the nurse's station and stopped walking. "You look like you haven't slept," Rosa said. "A few hours." "What happened?" Not a question, more like a person taking inventory. "A great deal." Mara turned from the monitor. "The review is at 8. "I heard." Rosa came the rest of the way to the station, set her bag down, looked at Mara carefully. "The federal agents are still here. There are more of them than last night. And there is a very serious woman on the 4th floor who told me the elevator was temporarily restricted, which," she gestured at the building in general, "is not a thing that happens. It's being managed. By you. By people with more authority than me." A pause. "I'm assisting." Rosa looked at her for a long moment. "Mara, are you safe?" The question landed simply, and Mara answered it in the same register. "I think so. Not certain. Better than 6 hours ago." Rosa absorbed this with the steady composure of someone who had decided, at some point in the night, to trust the situation because she trusted the person in the middle of it. She pulled her stethoscope from her bag and draped it around her neck. "Tell me what you need." "Nothing right now. Work your patience. If anything changes on the floor pattern, new faces, maintenance requests, anything that doesn't fit, find me immediately." "Okay." Rosa paused. "Aldrich told me you caught something in the supply room last night." "Aldrich talks." "Aldrich cares." A small correction, not defensive. He said it calmly, which means he thinks you're competent. From Aldrich, that's a formal commendation. She moved toward her first patient bay. 8 o'clock. I'll be watching the clock. The next hour moved with the strange dual quality of time in high-pressure situations, where individual minutes contain too much and the aggregate passed too quickly. Mara worked her patience. She kept her phone in her scrub pocket, and she kept her peripheral attention on the building's rhythms, the arrival patterns, the corridor traffic, the specific sound register that told you when a space was functioning normally versus when something in it had shifted. At 7:20, Keene found her. "EOD cleared the device," she said. "It was viable. Sophisticated timer, secondary trigger. It would have activated on approach, not on a clock." Her voice was flat, but her eyes were not. "2 of my people would have walked into it." Mara said nothing. "The man from the supply room is talking," Keene continued. "Not voluntarily. He lawyered up within 4 minutes of custody, but his devices are talking. The phone we pulled has location data going back 11 days. He's been in Delport for 11 days. She looked at Mara steadily. "He visited this hospital on 3 separate days before last night, including twice during business hours, in street clothes, as a visitor, getting the layout, and confirming your shift schedule." A pause. "Your name was in his contact directory under a code. We broke it in the last hour. The contact who sent him your schedule is not a federal employee." She paused again, and this time the pause was doing something. "The contact is on this hospital's administrative staff." Mara looked at her. "We don't have a name yet. We have an IP address and a communication pattern. The analysis team says 2 hours, maybe less." Keene held her gaze. "I want you to go to the 8 o'clock review as scheduled. Because whoever it is will be there." The administrative review was scheduled through Pratt's office. It involves Pratt, the administrator, and HR. She let that sit. The IP address traces to a device registered to hospital administration. The weight of it settled. Not Pratt herself. Mara had read Pratt as someone whose cruelties were institutional and personal, powered by ego and the specific toxicity of unchecked authority, not by anything operational. But someone in that circle, close enough to Pratt's process to receive scheduling information, close enough to the hospital's administrative network to pass it to a man who spent 11 days preparing a kill scenario. "I'll be there," Mara said. "Don't go in armed with what you know. Let it run. If we tip it early, we lose the connection, and whoever it is goes dark. Keen's voice was precise. Can you do that? Mara considered being asked whether she could sit in a room with an unknown person and present no indication of what she knew. She considered this for approximately 1 second. Yes, she said. At 7:50, she changed out of her overnight scrubs into a fresh set from her locker. She washed her face again. She stood at the staff room mirror for a moment and looked at herself. The scars, the tiredness under her eyes, the specific quality of stillness that she had been told at various times and by various people was either reassuring or unsettling depending on where you stood in relation to it. She looked like what she was, a person who had been through a long night and knew what the morning contained and had decided to walk into it anyway. The conference room on the second floor held, when she arrived at 3 minutes before 8, the following people. Whitfield, the administrator, who had clearly also not slept well and showed it in the careful way he was holding his coffee cup. Pratt, who was in her pressed scrubs and her prepared statement posture, the folder in front of her thick enough that she had spent time on it. The HR director, a quiet woman named Solace, who had the watchful neutrality of someone who processed these situations without personalizing them. And a man Mara had not seen before, seated to Whitfield's left, introduced as the hospital's legal liaison, name of Gareth Pell. Mara sat. She put her hands on the table. She looked at the people in the room the way she looked at rooms, assessing, cataloging, noting the distances and the angles without moving her eyes in a way that anyone would clock as surveillance. Pell had his own laptop open. That was unusual for a legal liaison at an internal HR review. She noted it. Whitfield opened the meeting with the formality of someone reading from a script he had written to protect himself from the outcome, regardless of what the outcome was. Grounds for review, documented incidents, the agency notification process, the hospital's right to terminate a traveling contract under specific clauses. He read it smoothly. Pratt watched Mara while he did. When he finished, Pratt opened her folder. I have documented 2 incidents, she began, as well as a pattern of conduct that... The conference room door opened. Keen walked in. She was followed by 2 agents Mara had not seen before. Not the operational agents from the hallways, but a different type, quieter, with the specific quality of people who worked in offices rather than corridors, and were formidable in a different register. One of them was carrying a document case. Whitfield stood slightly, the instinct of someone who was not sure if this was a situation that required standing. Agent Keen, this is a private administrative... I'm aware of what it is, Keen said. She looked at Mara briefly, the look of someone confirming a position before executing a plan, and then looked at Pell. Just at Pell. The look lasted 1.5 seconds. Pell closed his laptop. It was a small movement, reflexive. The movement of a person whose instinct, when attention moves to them unexpectedly, is to close what is open. Under normal circumstances, it would have meant nothing. In a room where Mara was watching for exactly that response, it meant everything. Mr. Pell, Keen said, I'd like you to step out with us, please. The silence in the conference room was the kind that happens when everyone in the space understands simultaneously that the meeting they thought they were in is not the meeting that is actually occurring. Pell looked at Whitfield. Whitfield looked at Keen. Pratt looked at her folder and then slowly raised her eyes to Pell, with the expression of someone watching a building they thought was sound begin to show a crack. I don't think I need to... Pell began. It wasn't a request, Keen said. Pell stood. He stood the way someone stands when they have calculated their options and found them limited, and have decided that the only remaining variable they can control is how they stand. He buttoned his jacket. He picked up his laptop, and his agent moved to take it from him with the efficiency of someone who had been waiting for that exact moment. He went with them. The conference room door closed. The remaining 4 people in the room sat with what had just happened. Whitfield set his coffee cup down carefully. Solace looked at her own notes. Pratt was looking at the closed door with an expression that was not yet fully resolved. The face of someone watching a structure they had built begin to separate from its foundation, not yet certain of the extent of it. Mara sat with her hands flat on the table and said nothing. It was Solis who spoke first, in the quiet voice of someone who had been a witness to institutional events long enough to know when one had just occurred. I think we should pause this review, she said, addressing Whitfield, until we have a better understanding of the context. Whitfield nodded. He looked like a man who had been handed a simpler version of a problem he had been dreading. Pratt said, "This review is a separate matter. Whatever the federal situation is." "Diane." Whitfield's voice was not loud, but it was definitive in a way his voice had not been the night before. The night before he had been managing optics. This morning he was managing liability, which concentrated a different kind of attention. "We'll pause." Pratt looked at him. She looked at Mara. And for the first time since 7 o'clock on the previous morning, when she had stood in the locker room doorway and looked at the new travel nurse, the way an inspector looks at a structure she had already decided was substandard, her expression contained something that had not been there before. It was not remorse. It was not quite fear. It was the specific expression of someone who has spent a long time operating in a system they believed would always move in their direction, encountering the moment when the system turns. Mara looked back at her without heat, without satisfaction, without anything that could be read as triumph. She was tired. She had been in this building for over 20 hours. Her feet still hurt, and her coffee had gone cold, and somewhere upstairs, Warren Aldgate was recovering from a poisoning on a timeline that had been dramatically compressed by the intervention of a travel nurse nobody at this hospital had thought was worth listening to. She thought about the sealed document that was currently being pulled and transmitted through a secure channel by someone above the compromised tier. She thought about Dorian Cass, who was not at her apartment and not in custody, and who had sent her a photograph designed to make her run so that she would be in open ground when whatever he had planned for open ground was executed. She thought about the reflection in the glass, the shoulders, the posture, the 6-year absence, and she thought about what it meant that he was still moving, still operational, still 3 steps into a plan that had been interrupted but not stopped. Keene had told her to come to this meeting. Keene's analysis team had said 2 hours for the IP trace. The IP trace had resolved in 40 minutes. That meant either the analysis team was faster than they said, or the resolution was easier than expected, or Pell had done something in the last 12 hours that made the trail simpler to follow, or someone had helped them find it. She pulled her phone under the table and looked at the screen. One message from the encrypted channel arrived 4 minutes ago. He came to us. Lobby. Now. She read it twice. Then she stood and said, with the composure of someone delivering a routine notification, "Excuse me for a moment," and walked to the conference room door and opened it, and moved into the corridor with the specific measured pace of someone who has just understood that the morning has one more turn in it that none of them saw coming. The elevator was faster this time because she did not hesitate at the stairwell door, did not calculate routes, did not do anything except press the lobby button and stand with her back against the elevator wall and look at the message one more time. He came to us. Lobby. Now. The pronoun was doing significant work in that sentence. He, not a subject, not the individual, not the operational language Keene used for everything that needed distance. He. Which meant Keene had written it fast, and fast meant the situation in the lobby was live and moving. The elevator opened on the ground floor, and Mara stepped out into a lobby that looked, from 15 feet away, entirely normal. The morning shift arriving, a family with a child in a stroller waiting at the information desk, the overnight security guard in the middle of a handoff to his day replacement. Normal in the way that things are normal when the people managing the abnormal have done their jobs correctly. She found Keene in 20 seconds, which was the amount of time it took to read the lobby properly. Keene was near the east wall, standing at an angle that allowed her to watch the main entrance and the corridor junction simultaneously, with an agent at each point she wasn't covering herself. Between them and the main entrance, sitting in one of the lobby's upholstered chairs with the particular stillness of someone who has made a decision and arrived at the place the decision required, was Dorian Cass. He looked older than 6 years should have made him. The photographs she had seen, the file photographs, the operational headshots, the one blurred surveillance image from 4 years ago that Aldgate's team had dismissed as inconclusive. None of them had prepared her for the specific quality of how a person ages when they have spent 6 years outside every system that normally accounts for a human life. He was lean in a way that suggested not fitness, but the long-term economics of living without infrastructure. His hands were in his lap, visible, which was deliberate. He was not cuffed. He was simply sitting, and the 2 agents positioned within 12 feet of him were positioned as much for form as for function, because a man who walked into a federal operations field location and sat down in a lobby chair was not a man who intended to run. Mara stopped at a distance of 8 feet. He looked up. He had the eyes of someone who has run a very long race and has recently, perhaps this morning, decided to stop. "Captain," he said. "You're not dead," she said. "No." A pause. "I tried to be for a while. It's harder than people think." She looked at him for a moment, at the hands in his lap, the visible fatigue, the precise way he had chosen this chair and this position, with his back to the wall and clear sight lines to every entrance, the habit so ingrained it survived the decision to surrender. "The device in my apartment wasn't intended to harm you." His voice was even. "It was a contingency for the units. I needed a window. I needed the response to be elsewhere for 40 minutes. He held her gaze. "I wasn't going to use it. I want that on the record." "That's not how devices work," Keene said from 6 feet to Mara's left. "Intention and activation are two different conversations." "I know." He did not look at Keene. He kept looking at Mara. "I need to make a statement. Full disclosure. Everything I have on the network that sent me here, on the funding chain, on the operational logistics of last night, and the 4 prior operations in the same series." He reached slowly into his jacket. 2 agents moved. He stopped, showed his hand empty, reached again more slowly and produced a drive. Small, matte black. He held it out toward Keene without looking at her. 22 months of documentation. I've been building it since I understood I couldn't get out the way I came in. Keene took the drive. "Pell," he said. "He's been the domestic relay for 14 months. He doesn't know the full structure. He knows 1 tier up and 1 tier down, and he was paid well enough not to ask questions above his sight line." He looked at his hands. "He's not the problem. He's a symptom." "Who's the problem?" Mara said. A pause. "There are 4 names on that drive. People above Pell, above the network that hired me, above the operational tier that ran last night." He looked up at her. 2 of them have federal appointments. 1 is currently active. He said it without drama, the way you say something that has been a weight for so long that the act of saying it is its own kind of relief. "I'm not asking for immunity. I'm asking for the record to reflect that I walked in." "That's not my call," Keene said. "I know whose call it is." He looked at the ceiling briefly, then back at Mara. "I came here because of you, not to find you, because of what you did last night." Something moved across his face. Not sentiment, but the close cousin of it. The kind of thing that happens when a person who has been operating in moral darkness for a long time watches someone they once worked alongside do something that is simply, uncomplicatedly right. "I watched your file. From the outside. When they flagged you as a target, I pulled everything I could access." He paused. "The flag you put on my pre-operation record. The one that got overridden. I didn't know about it until 8 months ago." Mara said nothing. "You told the truth when it would have been easier not to, before anything happened. You saw the discrepancy, and you filed it, and you did it knowing command wasn't going to listen, and it was going to cost you friction with people you had to work alongside." His voice was flat, not theatrical. "And then the operation went wrong, and you carried people out of it, and you never made it about being right. You just did the next thing." He looked at the lobby floor. "I've been doing the wrong next thing for 6 years. I got tired of it." The lobby was quiet around them, in the way lobbies are never usually quiet. The family at the information desk, the security guard handoff, all of it proceeding on the surface, while underneath the space held something that had the weight of a long account being settled. Keene said, "We'll need you in a secure room. This lobby isn't—" "I know." He stood. He was taller than Mara remembered, or she had misremembered, which was possible. Memory in operational context was precise about some things and wrong about others. He straightened his jacket. He looked at Mara one more time. "For what it's worth. What they did to your record, the discharge, the ceiling, the way you disappeared from the institutional picture, that was not incidental. There were people who found it convenient that you were outside the system, out where you couldn't ask questions from a position that required answers." She looked at him. "It's in the documentation," he said. Section 3. Keene moved him toward the corridor with the efficient choreography of an arrest that had already decided it was a surrender, and Mara stood in the lobby for a moment and watched him go, And then she turned back toward the elevator because there was still a conference room on the second floor with 4 people in it who were waiting for the morning to resolve itself. She rode the elevator up. She stood in it and looked at the floor numbers changing, and she thought about Section 3 of a 22-month documentation package on a matte black drive, and about the word convenient, and about the specific shape of how a person gets removed from the places they belong. Not through one decisive act, but through accumulated institutional friction. The incident reports, the contract flags, the recommendations that travel from one administrator to the next. The way a personnel file can be quietly curated over time to tell a story that was never the true one. She thought about a locker room, and maybe you're just not cut out for this, and about a conference room and first shift and already 2 separate incident flags, and about the particular efficiency with which a system can be used against the people it was supposed to serve by the people it chose to trust instead. She stepped out of the elevator. Aldgate was in the second floor corridor. He was not supposed to be out of his room, and the agent who had been stationed outside room 412 was 3 steps behind him, with the expression of someone who had said this several times already. He was in a hospital gown and a coat that someone had brought him, one of the agents, too wide in the shoulders. And he was moving with the careful deliberateness of a man whose body was operating on a shorter budget than usual, and who had decided that was not sufficient reason to stay in bed. He saw her face when she came off the elevator. "He turned himself in," she said. "I heard." He had a phone in his hand. "I've been on with the deputy director for the last 12 minutes. He looked at her steadily. The 4 names on the drive. 2 of them I knew were problems. 1 I suspected. One, he paused. 1 is going to require a very careful next 48 hours. Does it change what happens here, at this hospital? No. Immediate. Firm. That's already in motion, and it proceeds regardless of the larger investigation." He looked at the conference room door down the corridor. "Is Pratt still in there?" "As far as I know." He started walking toward it. She fell into step beside him because there was nowhere else she was supposed to be, and because she wanted to see this not out of vengeance, she was honest with herself about the distinction, but because she had spent 22 hours in this building being assessed by people who had not looked at her correctly, and she wanted to be present for the moment the assessment was corrected. She had earned that much. Aldgate opened the conference room door without knocking. Whitfield looked up. Pratt looked up. Solis had her pen in her hand and lowered it slowly. The legal liaison's empty chair was still pushed back at the angle of a person who left quickly. Aldgate sat in that chair. He did not introduce himself to the room. He looked at Whitfield and said, "Warren Aldgate, you know the office." And Whitfield's expression confirmed that he did. "I need 15 minutes of this room's time. After that, you can proceed with whatever you are doing." Whitfield nodded. He had the look of a man who had been having a difficult morning and had just been handed a version of it that was significantly above his pay grade. Aldgate looked at Pratt. She held his gaze for a moment with the residual defiance of someone who has not yet fully processed that the ground has changed, and then something in her face shifted, the recognition of a room that is no longer organized around her authority. Coming in through her expression, the way cold air comes through a gap you didn't know was there. "The travel nurse you've been attempting to terminate," Aldgate said. "Mara Voss?" He did not look at Mara when he said it. He kept his eyes on Pratt, and his voice was the voice of someone making a record rather than having a conversation. "Her contract will not be terminated. The incident reports filed against her will be withdrawn. Any escalation to her staffing agency will be recalled." He paused. "These are not requests." "The incidents were legitimate procedural," Pratt began. "The incidents were 2 occasions on which she prevented patient deaths using correct clinical judgment that exceeded the preparation of the physicians present." He said it without inflection. "The documentation of those incidents will be corrected to reflect that accurately." He glanced at Solis. "HR will manage the correction process. The original reports will be sealed pending review by the hospital's board, which will be contacted by my office this afternoon." Solis wrote something. Her face was neutral in the way of someone who processes institutional accountability events with professional detachment and is very good at her job. Pratt said, "You can't simply come in here and—" "Diane." Whitfield's voice was quiet. "Stop." She looked at him. He was looking at the table. He had made, in the space of the last 4 minutes, a calculation about the shape of his own remaining career and what it required. and the calculation had resolved somewhere that did not include further defense of a position that was no longer defensible. Pratt looked back at Aldgate. She looked at Mara. And for a moment, one honest, unguarded moment in a face that had spent 22 hours being anything but, she looked like what she actually was. A person who had wielded institutional power as a substitute for clinical competence for long enough that she had stopped being able to tell the difference, and who was now sitting in the room where the difference had been made absolute. She said nothing. Aldgate turned to Mara. Your sealed file. Section 3, as I understand you've been made aware, contains documentation of circumstances surrounding your discharge that were improperly influenced. He said it with the precision of a man who had chosen his words and would not be adding to them. The discharge will be reviewed. Your full service record will be declassified to the degree that it can be used in your current civilian context. Your commendations, all of them, will be restored to accessible record. He looked at her directly. I should have done this 14 months ago. Yes, she said. You should have. He accepted this without flinching. It was one of the things she had assessed about him, in the small hours of this particular morning, that she filed under useful rather than reassuring. He could absorb a true thing even when it was not comfortable. There's one more thing, he said. He reached into the coat that was too wide for him and produced a folded document, physical paper, printed, which in this context meant it had come off a secure printer in the last hour, probably while he was on the phone with the deputy director. My office is establishing a medical advisory role, attached to the Federal Emergency Response Unit, classified to the appropriate tier, civilian appointment, flexible, in terms of institutional base. He set the document on the table. The role was written for someone with a specific combination of military medical background and current civilian practice. I'm offering it to you. The conference room was very quiet. Mara looked at the document. She looked at the table. She thought about a 12-minute walk from the water, and about an apartment with a broken window latch, and about the particular tiredness of being somewhere long enough for it to start being yours, and then having it become something else without your consent. She thought about Gerald Marsh in Bay 2 with his pressure at 74/40, and about Jonah the 13-year-old asking for his mother between breaths, and about Rosa showing up 10 minutes early and asking what she needed. She thought about what it meant to be needed in a place where the need was real. I'm going to decline, she said. Aldgate looked at her. Not the declassification, not the record correction. She was clear about this. Those are right and they should happen and I want them on the record. She looked at him steadily. But the role? No. You'd be doing what you did last night, at scale, with the appropriate, I'm already doing what I did last night. She said it without heat. At whatever scale is in front of me, that's enough. She looked at the document and then at him. You need people who want the operational context. I want this. She gestured, at the room, at the hospital around it, at the whole complicated ordinary machinery of a building full of people who were sick and scared and needed someone to fight for them, who was not going to be impressed by their insurance status, or their appearance, or the thickness of their file. I'm not interchangeable with someone who wants what you're offering. He held her gaze for a long moment. Then he folded the document and put it back in his coat. All right, he said. He stood. He looked at Whitfield. The board will receive my office's correspondence by end of day. I'd recommend having your response prepared before noon. He looked at Pratt one more time, not with cruelty, not with anything that could be called satisfaction, but with the specific quality of attention that powerful people give to situations they are formally closing. Miss Pratt, my understanding is that your conduct toward Ms. Voss over the course of yesterday will be part of the board's review. That review will include witness statements from nursing staff. He paused. I'd recommend you speak with an attorney. He left. The room sat with what he had left in it. Solis capped her pen. She looked at Whitfield, who nodded, and she began writing something on a fresh sheet, quickly, with the efficiency of someone who knows exactly what form the next hour's documentation needs to take. Pratt was looking at the table. Her folder was in front of her, still thick, still organized, and now entirely irrelevant, and she was looking at it the way you look at a significant amount of work that has just been rendered without purpose. She did not look like a villain in that moment. She looked like a person who had built a structure out of the wrong materials and was sitting inside it while it settled into what it had always been. That was almost worse, Mara thought. Almost. Whitfield looked at Mara. He had the expression of someone running several calculations simultaneously and landing on the one that required him to say something he had not been prepared to say 24 hours ago. Ms. Voss, on behalf of the administration. He stopped. Started again. I did not handle your arrival well, or the events of yesterday. I'm sorry for that. She looked at him. He was not a bad man. He was a man who had made a long series of small, convenient choices and had arrived this morning at the bill for them. Thank you, she said. It was enough. It was the appropriate size of acknowledgement for an appropriate-sized apology, and she was not interested in making it larger or smaller than it was. She picked up her badge from the table where she had set it when she sat down. She clipped it to her chest pocket. She looked at Pratt one more time, and Pratt looked up, finally, and met her eyes. And whatever Pratt saw in them made something in her face close down in a way that was not defiance and was not remorse and was somewhere in the complicated territory between them. Mara walked out. The corridor outside the conference room was the same corridor it had been when she walked in, which was true and also somehow not true. The way spaces change when the meaning of what has happened inside them changes. She stood in it for a moment. Her feet hurt. Her eyes were dry from too many hours of fluorescent light. She had a shift that technically had not ended yet, and a set of patients whose morning medications needed checking and a bay that needed restocking from the overnight volume. Rosa was at the nurse's station when she got back to the trauma floor. She looked up. She read Mara's face with the speed of someone who had spent the last hour doing exactly that in her head, running the possible versions of the morning and landing on one and then another, and then deciding to wait and see. Well, Rosa said. Well, Mara said. Are you fired? No. Rosa let out a breath. Not dramatic, just the simple physical release of tension that has been held for a specific duration. Pratt? Board review. She'll know by end of day. Rosa absorbed this. She turned back to the chart she had been updating, then turned back. Pell, the legal liaison. In federal custody, there are others above him. The man from last night. Cooperating. Rosa looked at her for a long moment. And you? I'm going to check my patients, Mara said, and then I'm going to find out whether the coffee in the break room is fresh or if it's been sitting since 4, and either way I'm going to drink it. Rosa almost laughed. It came out as something that was close to a laugh but had too much of the night in it to be quite that light. She turned fully back to her chart. Bay 2, Gerald Marsh. They brought him back down from ICU for a follow-up check. He's asking who placed the IO yesterday. Tell him it's not important. I'll tell him no such thing, Rosa said evenly. He's a 47-year-old man who almost died and wants to thank someone, and he deserves to do that. She did not look up from her chart. Bay 2. Mara went to Bay 2. Gerald Marsh was propped up in his bed with the specific alertness of a man whose body had been through something serious and was now conducting the surprised inventory of still being present. He was pale, but tracking. His color was better than it had been at any point in the previous 15 hours. His wife was in the chair beside him, a small woman with the kind of face that showed exactly what she had felt the night before and had not yet stopped feeling. He looked at Mara's badge, then at her face, then at the scars, the way everyone looked at the scars, and then away again, and then back. Not with the discomfort of the previous morning's responses, but with the attention of someone who is looking at a person. You're the one, he said. I'm one of several people who worked on you last night, she said. Dr. Reese managed your care. The team, you know what I mean. His voice was rough from the intubation, but it was steady. My wife said there was a moment. They told her there was a moment. There was a moment, Mara said simply. It passed. His wife made a sound that was not quite a word. Gerald Marsh looked at Mara for a long moment. He was not a man who cried. She could read that in him, the particular construction of a person for whom that specific expression was not available, but his eyes were doing something near the edges of it. Thank you, he said. That's not enough. I know it's not, but it's what I've got. It's enough, she said. She checked his chart. She reviewed his overnight labs. She spoke briefly with the day attending who had taken over his care and confirmed the medication transitions were correctly ordered. She did all of this with the same economy she brought to everything, the same quality of presence that was not warm in the performative sense but was real. in a way that patients felt without always being able to name, the sense of being attended to by someone who was not somewhere else. When she came out of Bay 2, the trauma floor was running its morning rhythms. The day shift in full complement now, the overnight staff finishing their handoffs, the particular energy of a space shifting from its night register to its day one. She moved through it, and it moved around her, and she was checking her next patient's vitals when she heard, from the direction of the nurse's station, a voice she recognized. Dr. Reese. She did not stop what she was doing. She finished the vitals, made her notation, and came out to the station, where Reese was standing with a chart in one hand and the expression of a man who has something to say and is deciding, as he often seemed to decide, how to say it in the way that costs him the least. "The board is meeting this afternoon," he said, "about Pratt." "I heard. I'll be submitting a statement." He looked at the chart he was holding, then at her. "What she said in this unit yesterday, to you and about you, that's separate from the incident reports. I should have addressed it in the moment." A pause. "I didn't. That was wrong." She looked at him. He was not comfortable saying this. It showed in the set of his shoulders, the careful flatness of his voice, the effort of a man who had decided that the discomfort was not a sufficient reason not to say it. "Okay," she said. "I'm not sure what I expected you to say to that." "I know." She picked up her next chart. "File the statement. It matters more than what you say to me." I was quiet for a moment. "The I.O. yesterday morning, what you did in Bay 2 last night." He looked at her directly. "I've been doing this for 16 years. The combination, the speed of the assessment, the intervention sequence. You didn't learn that in any civilian context." "No." "You're not going to tell me more than that?" "No." He nodded slowly. It was the nod of a man who had decided to accept the parameters of what he was going to be told and operate within them. "All right." He started to move away, then stopped. "For what it's worth, this floor is better with you on it." It was the most direct thing he had said to her in 24 hours, and she believed it was true, and she believed it cost him the appropriate amount to say, and that made it worth receiving. "I know," she said, and went back to work. The morning moved. The calls came in. A construction worker with a hand injury, a college student with a suspected appendicitis, who was scared enough to talk too much, so Mara let her talk and answered the questions she was actually asking underneath the ones she said out loud. A 70-year-old man with chest pain that turned out to be musculoskeletal and not cardiac, who cried briefly from relief and then apologized for crying. And Mara told him that was a completely reasonable response to finding out you were not dying today. And he looked at her like she had said exactly the right thing. At 11:40, Keene came down one final time. She had the look of someone who has been processing a large amount of information quickly and has arrived at the part of the operation where the acute phase is over and the long institutional machinery of consequence is beginning to engage. She looked tired in the specific way of people who are competent at high-pressure work and pay for it after. "Koss is in federal custody," she said. "He's been cooperative. The drive is being processed. The 4 names are confirmed. The documentation is solid." She paused. "It's going to be a long investigation. Months, possibly longer." "I know." "You'll be called to provide statements, multiple times." "I know." "Your file. Aldgate's office sent the declassification order this morning. It'll take a few weeks to process fully, but the record correction is in motion." She looked at Mara steadily. Section 3. The people who influenced your discharge. 2 of them are already connected to the names on the drive. The shape of it, the long, clean line of it, from a flag filed in a pre-operation briefing 6 years ago to a locker room in Delport, Washington, to a conference room where someone sat with a folder full of incident reports and called it a personnel matter, settled into place the way things settle when you have been carrying their weight for long enough that setting them down changes the way you stand. "Okay," Mara said. Keene looked at her for a moment. "How are you?" It was a simple question, and it deserved a simple answer. "Tired," Mara said. "And okay." "That's an accurate combination." Keene put out her hand. Mara shook it. "If you ever reconsider the operational role, I won't." "I know." A small, genuine movement across Keene's face. "But the offer is in the file." She left. At 2 in the afternoon, Rosa appeared at Mara's elbow while she was updating her end-of-shift documentation. She set a cup of coffee on the desk beside the keyboard, fresh, from the good machine on the third floor that required knowing it existed, which most of the trauma staff didn't. "Board meeting finished 20 minutes ago," Rosa said. Mara looked up. "Pratt is suspended, effective immediately, pending formal review. Whitfield made the announcement to department heads at 1:30. Rosa paused. "She was in her office when security came. They said she didn't argue." Another pause. "I don't know whether that's better or worse." "Neither," Mara said. "It just is." Rosa sat in the chair beside the station. She had the look of someone who has been through a long experience and is taking the first moment that has been available to actually feel the length of it. "You know what I keep thinking about," she said. "Yesterday morning, when you walked into that locker room and Pratt said what she said and you just didn't." "Didn't what?" "Didn't break. Didn't fight back. Didn't do the thing I would have done, which is say something I regretted for the next 3 weeks. Rosa turned her coffee cup in her hands. "I kept thinking yesterday that it was patience, discipline, whatever the military version of keeping your mouth shut is called." "It's called patience," Mara said, "but it wasn't that." Rosa looked at her. "Was it?" Mara was quiet for a moment. The question was real, and it deserved a real answer. "It was knowing," she said, "not what was going to happen. Just knowing that what people say about you in a room is not the same thing as what you are, and that if you have enough of the second thing, you don't have to spend a lot of energy defending it from the first." She looked at the monitor. "The scars are ugly. I know that. They've always been ugly. But they're also the exact shape of the thing I did that made them, and I know what that thing was, and nobody's opinion of the scars changes that." She picked up her coffee. "So you wait, and you do the work, and the work eventually speaks in a register that opinions don't." Rosa was quiet for a moment. "That's very hard," she said. "Yes," Mara said. "It is." They sat for a moment in the comfortable quiet of two people who have been through something together and do not need to keep talking about it to know that it was shared. At 3 o'clock, her shift ended. She updated her last chart, completed her handoff notes, spoke briefly with the evening charge about 2 patients whose status had changed in the last hour, and then she went to the staff room and retrieved her bag from her locker and stood for a moment in the room where she had eaten lunch alone the day before. The room was empty. The cot was folded against the wall. The break table had someone's leftover coffee rings on it and a note that said, "Whose dish is this?" in handwriting that was accusatory even at small size. Normal. Entirely, completely normal. She went down the corridor toward the side exit. Rosa was at the nurse's station and looked up as she passed. "Tomorrow," Rosa said. "Tomorrow," Mara said. She pushed through the side door into the afternoon. The rain had stopped sometime in the morning while she was inside, and the world had the specific quality it has after a long rain, washed clean in a literal sense, the parking lot dark wet, the air cooler and more direct than it had been, the light coming through the cloud cover at the angle of a day that is ending earlier than it started. She stood for a moment at the edge of the lot and breathed it. Her apartment had a broken window latch and an EOD clearance, and an unresolved question about what it felt like to go home to a place where someone had been looking for you. She thought about this practically. She would call the landlord about the latch. She would take the long route home to give her legs something to do. She would sleep in her bed and not in a staff room cot, and she would wake up tomorrow and come back here. She was not the same person who had driven into Delport 6 weeks ago, or she was exactly the same person, and the difference was that the space around her had finally caught up to that fact. She was not restored. She was not fixed. She was not the subject of the kind of clean narrative where wounds resolve into strength and everything that was broken heals straight. The scars were still raised and still the color of old rope, and they would never be anything other than what they were. What they were was hers. Everything that had made them was hers. Everything she had done with the person who carried them was hers. The flag filed in a pre-operation briefing that nobody listened to and that turned out to be the truest thing in the room, the hillside at 2 in the morning, the IO in Bay 2, the 7 minutes of a resuscitation that turned a dying man back into a man who would go home to his wife and his ordinary life and not know how close the margin had been. She thought about what Aldgate had said in the gray early morning of this very strange day, the downstream of what you did. The fact that actions have reached you cannot see. That the thing done correctly in a room where nobody is watching reaches forward in time and becomes something else. A life that continues, a door that stays open, a person who is present in the world because someone chose the right next thing on a bad night. You didn't do it for the downstream. That was the thing nobody told you, and that you had to find out for yourself. You did it because it was in front of you, and it was yours to do. And sometimes, not always, but sometimes, the universe eventually organized itself into a shape where the doing and the consequence were visible to each other across the years, and you got to see the line. She started walking. The water was 12 minutes away, and the evening light was sitting low and pale over the rooftops of Delport, and she had a long sleep ahead of her and work in the morning that would be ordinary in the best possible sense, full of people who needed someone steady in their corner, on their worst days, in the rooms they hadn't planned on being in. She had not planned on being a person whose life looked like hers. She had not planned on the hillside or the discharge or the traveling contract or the specific hostile silence of a charge nurse who had decided in 30 seconds what kind of person stood in front of her. She had not planned on any of it, and she had done the right thing in each moment of it anyway, and the moments had accumulated into something she had not foreseen from inside them, a life that was hers, entirely and without apology, every scar and every silence and every quiet decision to keep doing the next correct thing in the next room that needed it. The most powerful thing you can be is not invincible. It is the person who absorbs what the world throws at you, the dismissal, the cruelty, the small daily erasures, and does not let any of it change what you know to be true about yourself. That knowledge is the one thing that cannot be taken by someone who never had access to how it was built. It lives below the reach of opinion, below the level of institutional paperwork and personnel files and conference rooms with folders on the table. It lives in what you do in the moment when no one is watching and it's only you and the work and the choice. Mara Voss walked toward the water. Behind her, through the glass doors of Harwick General Hospital, the evening shift was beginning. The monitors were running. The bays were stocked. Someone in a trauma room was making a decision that would matter to a person who would never fully understand how much it mattered. She didn't need to be in the room for that to be true. She already knew what she had done, and she carried it the way she carried everything, quietly, completely, and without waiting for